John.
Okay, cool. I called and texted Abby.
Do we have Steve? Andrew? Good morning and welcome to the work session for the Pitkin County Commissioners on Tuesday, October 17th. This is a big budget day, so we're starting a little early. And the first presentation will be from Connie on the livable and supportive community budget. And we'll be doing this till lunch. I think we're ready, Connie.
Okay, good morning, everyone.
Can you hear? Let me check with Steve. Can you hear us okay, Steve?
Yes, can you hear me?
Steve, can you hear us?
Can you hear me, Francie?
Pandora, are you hearing that? I'm hearing him, but you're hearing. Oh, sorry, Steve. We had you muted here.
Can you hear us?
Steve, we had you muted in the room here. Could you just try again?
This should be okay. Can you hear me?
Yes, we can. Great. Okay, Connie.
Okay.
Okay. Oh, good.
The packet material for today's meeting includes this presentation, and it also includes the budget profiles for each department or fund that we'll be presenting today. Those budget profiles give some extra information, really good summaries, so if you want to go a little more in depth, you could read through those budget profiles. So this is the first of our core focus budget meetings. We look at the county's strategic plan, and it has these 3 circles on it. Each one is a core focus area. This is the livable and supportive community. And the success factors that were identified as really promoting this livable and supportive community are a sense of personal and community safety, diverse and livable housing options, self-sufficient individuals and families, access to recreation, education, arts, and culture, and improved community engagement and participation. So we'll be touching on a number of those today. If you see the smaller pie chart on this slide, the livable and supportive community is less than a quarter of the total proposed budget for the county, about 23%, $54 million. And you can see the breakout between the different funds and departments that we'll be looking at today. The library district is the largest in today's presentation. That's partly because they have a larger capital project with the building electrification. The sheriff is the next largest at about $7 million, and then the housing impact fee fund is just slightly below $7 million. So just a bit of a visual of what we'll be going through today, dollar-wise. The next chart gives a 3-year budget comparison. We always look at the prior year actual. So 2022, that's the last year that we have full data for. The 2023 original budget, and then our 2024 proposed budget. So you can see housing, general fund housing is shown on this line here. And you'll notice quite a big bump in that one. In 2022, we hadn't hardly even started having a general fund housing department to promote housing initiatives. An increase for 23, and then in 2024, this includes a placeholder for a lot of the board initiatives for housing. Not for capital development, but initiatives in support of other projects. And then down in the Housing Impact Fee Fund, where you see almost $7 million, that's for housing capital.
Those are those transfers.
Exactly, and we'll be going into that in a little more detail later this afternoon. So just a little overview of what we're looking at. We have a number of departments presenting. We'll start with Human Services and then Public Health this morning, and then after lunch, Library and Public Safety with Sheriff, Detentions, Coroner, Dispatch, and then we'll finish the day with all of the different housing areas. And our housing has become more complex with 3 different funds involved.
Francie, I just want to note, this isn't working, so I don't know if you want to note Steve to just jump in. Because we can't see.
Yeah.
Andrew had said to me he wanted to troubleshoot that at the break, that it's not
It's just not working.
functioning correctly.
Okay, so Steve, we can't see if you have your hand up or anything like that. So anytime you want to speak or ask a question, just go ahead and do it.
Okay, Francie, I'll do that.
Thanks.
One thing I'd like to point out before we get into the presentation is that you'll notice at the end of each presentation for a fund, there'll be a 5-year budget plan and the decision point. It's not a formal decision. It's just a thumbs up that the board's in general agreement for moving forward with what's being presented. There aren't any big changes that need to happen.
So there'll be little tabs or something there that,
Yeah, you'll see a little star up on the sheet for those 5-year plans.
great.
However, when a general fund department is presenting, you won't see that. You'll just see a 3-year expenditure comparison at the end. Once we've gotten through all of the general fund departments, then we'll come back with the general fund as a whole and a decision point on that.
Okay.
So just to distinguish between the two. There are a couple of areas that are part of livable and supportive community, but that won't be presenting today. They're coming up with meetings in November, the Healthy Community Fund and their grant recommendations, the district attorney, and then the ambulance district. So those will be yet to come. And with that, we've got the Human Services team here, so if they want to come up and start us off today.
All right. Well, I'm Sam Lander-Casper, and I am the Interim Director of Human Services for a few more weeks until Lindsay gets back from maternity leave. We also have Matt McGaugh, who's our Deputy Director of Programs and Services, and Stuart Fox, who is our Accounting Analyst. And we are here today to talk about the Human Services budget, which encompasses the Economic Assistance Department, which provides services like SNAP, Medicaid, other federally funded programs for low-income households. We have the Adult and Family Services budget, which is protection, adult and child protection services. We have Senior Services, which provides services to older adults. And we also have the Healthy Community Fund and admin budget all rolled into these. And one thing we had historically done in the past was we had approached each of these budgets more on a divisional level and brought it all together at the end. With the restructure, we were able to bring on Stuart, who was able to take a comprehensive approach to this budget. He put together a really good process for us, and I think with this year we've, for the first time, had a budget that really came together from the 30,000-foot view looking at the entire department. And I think we were able to streamline it in some areas. And I would just like to pass it to Stuart, who is going to run the show today for the most part.
All right. Thank you.
Welcome, guys.
So hopefully this will be a very concise and streamlined presentation. That's intentional. So this first slide, the whole purpose of this slide is not only to show our smiley, happy faces, but also to point out that for this proposed 2024 fiscal year, Human Services is not requesting an additional FTE. We're going to stay the same as last year. We did want to note, we had one addition last year. We brought in a mental health administrator, and that we just want to reiterate that that position is funded through a grant through the Rocky Mountain Health Plans. But other than that, we are staying the same FTE as last year. So on to the next slide. So we just wanted to highlight some of the interesting facts and highlight, the good work that many of our divisions within the department are doing. And you can see that Human Services serves a large proportion of Pickens County in a myriad of ways. Not highlighted on this slide, but I do want to give those divisions credit, is our Veterans Service Officer. He's out there making connections and really helping to serve our veterans in our county. And in addition, the previously mentioned mental health administrator is really making inroads with a lot of our partners. And so I wanted to give those individuals credit as well, even though we don't have interesting facts highlighted on that slide for them.
I have a question about
Yes, of
this.
course, please.
So the population of Picking County is 17,000 people.
Yeah.
So how could we have 4,000 households that don't make a self-sufficient wage? Seems like we only have like 4,000 households, period, if we have 17,000 people.
Yes, that's you.
All right. So we have also brought on in the last year with the restructure a program analyst, Meg Blazak, who is really helping us with our demographic data, right, to really help understand our populations. And this self-sufficiency standard or wage that we talk about is really the metric we're trying to use these days to understand people who might be in need of our services, right? Because a lot of our programs, the income limits drop off much earlier than what would be where people are actually earning enough to get by. So when we look at households, the household size in Picking County is actually a lot smaller than the average household size nationwide. We've got a lot of single person households here. So while we do have 17,000 individuals, 4,054 households would probably represent closer to 8 to 10,000 people instead of what some people might consider,
Okay.
a larger
So
group.
it's still more than half of our population don't make enough money for self-sufficiency?
Depending on where we draw that line, yes, it waffles between 40 to 60%. We would say somewhere in there is the sweet spot. We can't say exactly because of how the census data is. We can't actually draw down to individual household income, which would really be the place where we could start to see, would this household be meeting their self-sufficiency standard for that particular household? So
How do you differentiate it if you don't do it by household income? What kind of mechanisms do you use to come up with that?
So primarily we're using the U.S. Census data and the American Consumer Survey, the ACS. And we have to really kind of take general numbers, combine them, and look at, on average, where people would fall. So it's a guesstimate until we can get down to household-specific data. So we're saying there are this many households in Picking County. There's this percentage of people making, and Meg could explain this a lot better, making a certain amount of money, but that's based on percentage. We can't tie a certain income to a certain household. So it's really, it's our best guess.
So are we talking sort of roughly around the AMI, or are we talking about?
It's a little higher than AMI is where we,
Okay.
because we did look at
So
AMI
it's around 100,000 or something?
for
Household?
for a single person household. I believe it's around 72,000 a year. I think a 4-person household is closer to that 120 mark, if I remember correctly.
Okay.
Yep.
So they fall somewhere in that range.
Yes, exactly. And those are the folks who are below that is who we're looking at as far as saying these are folks who probably need either our services or the services of our partners. And that's where we come in as a connector, a collaborator, a convener to try to help build those gap services, or what we call basically what happens after the cliff effect, where people fall off of those assistance programs.
And so this number doesn't represent the number of people who have reached out to you. It's the number of people who could.
Exactly.
Okay,
That's
great.
the number of people we feel like we need to be in some way reaching out to, making ourselves available to them, making sure they understand what programs we have to offer, what programs our partners offer, to really help people have the resources they need to meet that self-sufficiency standard.
Okay. Thanks, Sam.
Yeah, no problem.
Perfect. All right. Any other questions on that interesting fact slide?
It is an interesting one.
Good. All right, we'll move on. All right, so this is highlighting the main priorities. I'm not going to read these verbatim, but wanted to highlight a couple of them. The first one, the emphasis on maximization of funding sources. That is where we are being very intentional on the revenue that we do get in, and we're using some terminology: blending, braiding, stacking. An example of blending would just be a real life example would be our partnership with the collective management program. We use the funding from that in our partner agencies. And if I don't articulate this, please interject. We just work with them, and that's an example of blending our funding. And so all we're trying to say in that bullet point is that we are very intentional within our funding parameters of using our money wisely.
I'll jump in quick. Yeah, I think along the lines of blending, braiding, and stacking, one thing that we did notice is we're also being intentional about how we bring in funds. In the past, we had sometimes found ourselves chasing after dollars that we might have ended up spending more time administering than we actually brought in. So we're trying to we have a grants analyst, we have Stewart on board, so we're really vetting some of the funding sources we're looking at. We're also trying to find new sources that might be more a more effective use of our time. And I think one thing that's interesting to note about this blending, braiding, stacking idea, it's really about how we draw down funding. And our budget is complicated because we bring in funding from so many sources that might be funding a single project. So we really have to be careful and intentional about how we use those funds so that we're making sure we're staying within the rules. Stacking is one that's come up recently with the Universal Pre-K program that was put in this year. And making sure that we're not drawing down funds before we're able to use other funds. So really, we want to make sure we're utilizing universal pre-K funds and then this child care assistance program funds, and that they don't overlap so there's no duplication. So really, it's just one of our priorities this year is to really take a hard look at all of the different funding sources we have, making sure that they're being used in the most effective way, and that we're also staying within the guidelines that we need to make sure we're not tiptoeing out of bounds on how those funds get spent down.
Thank you, Sam. I appreciate that clarification. Another priority I wanted to highlight was just the increase, and you'll see these in later slides, the increase in our education, training, and wellness budget. And that is that's really intentional to try to increase our staff's satisfaction and retention. And then finally, it goes hand in hand with the previous statement. We are going to continue on some of these workload studies, specifically with our EA and AFS case workers, to make sure that they have a good balance and that they're able to serve our customers, our clients, to the right standard that we want to be serving our community with. Questions on our main priorities? Perfect. All right, we'll move on. All right, so here's some changes to the 2024 budget. So you'll see that we have a decrease in overall revenue. A large reason for that decrease is we had a large one-time grant funding from the mental health, for mental health from the Rocky Mountain Health Plan, and we are not going to be receiving that grant. Hence, it was a one-time funding in 2024. Additionally, we also reduced our estimate of the revenue we thought we'd bring in from SNAP, just given the reduction in direct client benefits. We lowered that amount by $116,000. That also has a corresponding direct client benefit expenditure. So between those two reasons and some smaller reasons, that's why we have a reduction in our estimate for revenue that we're going to bring in 2024. On the expenditure side, we're going to see a 3.69 increase compared to 2023's budget. We've highlighted the vast majority of the reasons for those. And I think those are all well justified in why we're increasing those. And you can see there's that $21,000 increase in education and training for our staff. Questions on that?
It doesn't look very good to have a decrease in revenue and an increase in expenditures.
No, it does not. No, but that is the reality that we're facing right now.
Yeah, I would just add that some of the expenditures we're seeing increases on, such as the property tax refund program, these are really just coming through the human services budget. Again, TANF, $100,000 placeholder there. That's an allocation. So at the end of the day, we want to spend that money. That's getting services out to the community. So, you know, really at the end of the day, what we're looking at is a few increases around cleaning and education for the team. And our decrease in overall revenue, like Stuart highlighted, that SNAP decrease, those are all passed through. That's not money that actually ever even comes through Pickens County because that's a federal program. Those benefits are just getting pushed straight out to people. Obviously, we'd love to see that higher, but with the rules and the way the program's set up this year and after all the emergency COVID relief funds were cut, we expected to see that decrease in the SNAP revenue and expenditure.
Other questions on this one?
Just, do you want to talk about that a little bit? What has been the percentage in case drop related to the ending of those benefits, and how much did our checks get reduced that went out?
Yeah, so for SNAP, we've actually seen an increase in caseload. The reason the benefits are decreasing is that during the public health emergency, the federal, Food and Nutrition Services issued maximum benefits to everybody, right, to really account for all the folks who've been impacted by COVID, which meant that folks, the way you are approved for SNAP is not only whether or not you qualify based on your income. On a sliding scale, you may get a larger or smaller benefit amount. So a lot of folks who are receiving SNAP aren't getting the maximum. What they did is they opened that all the way up. They also were issuing additional emergency payments for a while. So people were seeing a huge increase in what would normally be their SNAP benefits that they were eligible for. So the decrease that we are seeing, which is about in the height of COVID, I think we were issuing around $83,000 a month, and now we're issuing closer to $52,000. So my math isn't good enough to figure that percentage out on the fly, but that's the decrease we're seeing, even though we do have an increase in caseload at this time.
Okay, thank you.
How much is that per, like, how many families is that?
I believe we have between 200 and 210 cases right now. Obviously, there's different household sizes in there. The majority, I'd say over half of our cases are single-person households. Obviously, the larger the household, the smaller number of cases we see. But like I said, it's about 280 individuals, 200 to 210 cases right now. And I don't know what that average benefit amount.
250?
Yeah, it'd probably be 250, 300, somewhere in there. Average would be my guess.
All right, we'll move on to that last slide. And this is that 5-year plan that Connie was speaking about. So this just highlights or surmises where we stand. Highlighted in green is the 2024 budget. And this is where we ask you guys for your decision point.
And if I could, I'd point out just a couple things for the board.
Okay.
As always, since this is our first meeting going through some of these, we've got the revenues listed at the top of the page. You'll see again our normal 3-year comparison up to the budget where we have 2022 actuals, 23 original budget, but then we also have 23 year-end estimates. So any supplementals through the year or projections where we think we'll actually end 2023. We've got our 24 budget, and then carrying that out through 2028. So you see the longer term effects. Is this sustainable, and what's required to sustain it long term? And when you're looking at the revenues, you'll notice that the intergovernmental is by far the largest revenue source. That's all of the grants. The state and federal allocations, they were mentioning the SNAP program, child welfare, child care, all of these come through that intergovernmental. So about $3 million in revenue. On the expenditure lines, we've got the salaries and benefits. It's the employees that provide the services, so that's a very important part of the budget. But then the largest of the other line items is other services. That includes the direct client benefits. So SNAP alone is about $725,000, around that range.
And that's a total pass-through.
the SNAP is a total pass-through. Others are not total pass-through. Some, the state or federal government covers 80%, some 90%. It depends on the program. So the reason you see that line item so big is because it includes all of those benefits that are being passed out to community members.
And that's why we don't show a deficit at our available fund balance.
Well,
It seems like we should.
Yeah,
with
so
the
if we go a little further down, other expenditures, I did want to point out, we've got the property tax refund program in that line item. You see a negative number, negative 100,000, just because if we budget at the state allocation numbers, we know that there are times that we don't spend the full amount, so we anticipate that in the budget. But then we have a section for transfers. And the transfers help to balance out the fund. We can't provide services at the level that the board has requested us to provide just on what the state gives in allocations. It takes additional county funding. There are also programs that they provide for homelessness and other types of food security that are not direct programs of the state.
They're not mandated.
Correct. So that $2 million from the general fund does include $200,000 for the property tax refund program, plus just some ongoing support. We do need to subsidize the human services
Okay,
fund.
so that's how we balance it at the end of the
That's
year.
how it's balanced.
Okay, great, thanks, Connie.
There's a transfer from the Healthy Community Fund, $572,000 for senior services.
Question. Can you explain to me again when I look at the out years and the operating deficit, do we anticipate that gets drawn out of the fund balance?
It could get drawn out of the fund balance. Typically what we see happening is that the end of the year, it will actually perform better than what we've budgeted.
Right, okay.
And that's what we've seen many, many years in a row. So even though we're showing very small deficits in those out years, we anticipate that by the time we actually get there, it will be balanced.
Sure.
We could draw down fund balance. There's a healthy fund balance for the Human Services Fund. We could also contribute a little bit more from the general fund.
Okay, thank you.
Well, you have a thumbs up from me.
Yeah, me too.
Steve?
Yes, I'm good. Thank
Okay.
you.
Okay.
All right,
Thank you so
that is
much.
us. Thank you, guys.
Thanks, everyone.
Thank you, guys.
Thank you.
That was very streamlined.
No, you're already ahead here. I mean, I could ask you a million more questions, but they're not all budget related, so. Yeah. Well, like policy and things like that.
Oh, thanks.
All right, shall we kick off here?
Yeah, go ahead, Jordana.
Good morning, Juliana Sabella, Public Health Director. I'm here with our managers for our team. Do you want to introduce yourself?
Sure.
Yes, I will speak better into there.
I'm Jenny Lyons, Programs, Education, and Partnerships Manager for Public Health.
Kurt Dahl, Environmental Health Manager.
And we are pleased to be able to present you our budget this morning. We have presented this to the Board of Health last Thursday, and they did recommend its approval in this current format. Moving to the next slide, you'll see our organizational structure in the Public Health Department. We've got 3 teams. The admin team led by Larissa Bonilla, who is out on parental leave right now. Jenny Lyons leads our Programs, Education, and Partnerships team, and then Kurt leads our Environmental Health team. We've been on this journey to come to be about what we consider to be right-sized. Before COVID, we were smaller than we wanted to be. During COVID, we were bigger than we wanted to be. And now we are weighing in at about 16 employees, which, according to a study that we did way back in the day, that's about the right size to be providing the services we need to our community.
It's like a Goldilocks story.
So exactly.
Were there any state incentives associated with that shift?
To becoming right size? No.
Because they basically said, all right, all 64 counties, y'all are out of compliance and need to figure it out.
No, there was an effort, a statewide effort to do a study about what would be right-sized for each of the departments. We participated in that study back in 2017, and the work for that is helping to, as part of this work called Public Health Transformation at the state level, and the effort is really to demonstrate how the staffing that's needed at the local public health level, and then demonstrate, because of the even required services that we need to perform, and then align that with the funding that comes down from the state, which we know is not enough to cover the requirements, let alone what our community expectations are locally. So at the state level, those studies will be used to help advocate for additional funding.
Do we have elevated community expectations? Yes, okay.
So the last point about this slide I just wanted to point out is that we are not currently requesting any full-time positions, but the staffing plan that we've brought in years past has been shown to the board, where we're planning for when Tom Dunlop does decide to retire. We'll be coming back to the board with a request to hire an environmental health specialist in air quality, and Kurt will talk a little bit more about that when we get to his section. So we did want to share one interesting fact about our public health department. 63% of our team do have advanced degrees. So a lot of this work that we do is very specialized, and we have a very well-educated team that we're fortunate to have as staff here. Next slide.
Congratulations on that.
Thank you. The next slide that we'll dive into will share each of the three different priorities for the different teams and budgets. So priorities for 2024 for our admin team. First off is to continue to implement our public health improvement plan. Those two priorities are around pathways to care, including mental health, as well as climate change and health, really promoting the relationship between the two, and doing what we can also in the emergency response, and helping to look at that with an equity lens, and make sure that we are adapting to the inevitable effects of climate change.
What does it mean to look at that through an equity plan, Jordana?
Through an equity lens.
Yeah, that's what I mean, yeah.
So we know that when we have these events that are going to be more frequent and more extreme due to climate change, flood, fire, different kinds of diseases that we've seen coming through, there will be populations that are disproportionately affected, so affected more than their neighbors. And so part of that equity lens is looking at who would be most affected in these different kinds of emergencies and trying to plan and prepare for that. So some of that is outreach, some of that is support, some of that is messaging. And so we're really just trying to take some time to delve into that and make sure that we're doing our best when it comes to planning.
Is it possible for you to give me an example of a community that would be disproportionately affected by something? I mean, I understand it in inner city areas and in a lot of other places. I can't quite picture what that looks like here.
Sure. Do you
You want me? So let's take heat. As much as we didn't think that heat was going to be an issue, and I'm thinking regionally, not just here, but you think about access to places that are cool at night, air conditioning. You know, when you start to look at income levels and housing and different housing stocks and what actually has air conditioning and doesn't, there's an example of where you have people who houses are 85 degrees at night when you're still trying to sleep, and that actually has a pretty big impact on your health and your ability to sleep and your mental health. So that would be an example. Flooding is another example where we have a number of structures, or we have a mobile home park that sits right at the convergence of the Frying Pan and the Roaring Fork. So if we have flooding issues here, that may be more disproportionately affected than, say, other places that are not along the river. Does that help? And then the
Yes, great,
income and
that
the
helps,
impacts
thanks.
of that flooding are going to impact the different populations differently in terms of how they can address the housing concerns with, once you've had the flooding, how
Right,
do you
and
redo the
recovery.
housing, how do we recover, building
Okay.
resilience?
I would add during COVID, I think we had a lot of key learnings on populations that we needed to have outreach to who maybe were in riskier jobs, whether they be frontline workers and those sorts of things, that we had language, cultural, and other kinds of considerations that maybe we're planning around in the moment versus pre-planning. And I think that was a real world example that happened right here.
Great, I appreciate that. I mean, we use the DEI words so often that sometimes it's nice to put a little face to that. So thank you.
Absolutely. The other priority for our admin team is our department strategic plan. So some of the priorities that we're working to finalize in that will be around communications, knowing we need to focus in on that, transitioning our COVID website into normal day-to-day website and how we do business, and developing our communication plan and those groups that we'll be outreaching to. We need to sustain and retain the workforce that we currently do have, our 16 employees. And then as well, we need to institutionalize those learnings that we did have from COVID, and make sure that we put procedures into place so we don't lose the knowledge that we have gained.
Question. When next do we do the community assessment?
We just finished it in 2022. So it will be another 5 years, so 2027.
Okay. It would be great to have you guys come in front of us and maybe present that along with the mental health assessment. And, you know, there's just one of me, so I'll look to board chair and to figure out if there's direction on that. But I think it would be really valuable. Thank you.
Okay. So proposed changes to the 2024 budget. A slight increase in the preventive block grant funding that we have, an additional $6,000 there from last year, and a decrease in the core public health services funding that we do get from the state by about $57,000.
That funding itself is going down.
Correct. If there's no questions there, I will turn it over to Jenny.
All right. Again, I'm Jenny Lyons, Programs, Education, and Partnerships Manager for Public Health. Next slide, please. So our team is, there are 5 of us on the team, and these are our priorities to take us through 2024. STEP is our State Tobacco Education and Prevention Program. The work around that will involve implementing the tobacco retail license that you all passed just a few months ago. Our investment from Public Health in that will be mostly in retailer education and compliance. We are also working to complete a tobacco community profile, which is part of the STEP grant requirements, and we will be doing an implementation plan for the next 3 years along with that profile. For the Picken area co-responder teams, or PACT, our goal is to support the PACT team to provide continuous services to clients in the field. We are recruiting new field team staff and hope to retain those that we have. We will also be completing a PACT strategic plan that includes program goals, growth, and funding sustainability, and further refining the PACT data to best tell the program's story and its community impact.
Can I ask you a question about that?
Of course.
So the field team who rides with the officers in Impact,
Correct.
they get paid by the county.
They get paid by Mind Springs.
Oh,
We
they get paid by
contract-
Mind Springs.
We contract with Mind Springs to provide those services.
I see.
Mhm.
Okay.
Is that our only contract with Mind Springs right now? Yeah. Thank you.
And then, so another part of our work is the mental health
I'm
access.
sorry, I have one more
Sure,
question
sure.
on that. Okay, so they're like on salary with Mind Springs, and so if we call and they go out with one of our officers, are we charged for that, or is that just part of the deal?
They're essentially on salary with Mind Springs.
Okay.
The 2 co-responder clinicians are salaried positions. The other 2 field positions, the peer support specialist and the case manager, are hourly positions, but they're generally working around 40 hours a week.
Okay.
So we've budgeted within PACT, which is completely funded by the state at this point. We'll go over that a little bit in our budget. But so the state is providing the money that we're using to contract with Mind Springs, and it is completely covering those positions.
Great, thanks.
Anything else on PACT?
Not right now.
Okay, we can switch back to it. Another piece of what we are doing over the next few years is the Mental Health Access Program, which is a joint program with Human Services. So we have one position that's within public health, the mental health data analyst, and the mental health programs administrator actually works for Human Services, and they work closely. But together they will be working on completing a strategic plan for the Mental Health Access Program. They are focusing as well on available data to understand the mental health system and where it can be improved or reinforced in the county. And they're also analyzing existing community partnerships to determine where we need to improve them or build any new ones.
I do have a question, and this is a sort of an overview question. It's not specifically about this. So we have health and human services, and we have the health department, and we have human services. How does that work, and how are they separated? I know that like you said, we share with human services a certain employee, and so where is the crossover for health and human services?
So they used to be one
Right.
department. So now we have human services and public health. Health and human services is still the name of the building, but the departments are differentiated. Human services tends to do more of that individual level support and outreach. So their point in time, they just described the nutrition services that they provide, economic services. They run their lead on a lot of our people who are experiencing homelessness work. Whereas the public health department tends to look at things more from the population level. And we have different core services and responsibilities.
Okay, thank you.
Our last priority for 2024 is around communications, which is a shared priority with the public health administrative team. But we do have the new health promotion coordinator that works with the PEP team. And so she is working on a 2024 communications plan, which includes campaigns for specific topic areas, and community partnerships are our top priorities. We learned during COVID that community partnerships are a key piece of responding to urgent public health situations, and we want to keep those relationships strong for the future. Next slide, please. We do have a few changes to the 2024 budget, increases and decreases. I talked about the fact that the PACT program is completely state funded, and the harm reduction grant fund, which is coming from Colorado Department of Public Health and Environment, is increasing by around $67,000 to support that strategic plan for PACT and some of the additional data work that we're doing. As well, we have a relatively new CDC infrastructure grant for a total of $217,000 that is going to support that health promotion coordinator, our communications position, over the next 2.5 years. This is a small one, but the child fatality prevention system, which is part of our core public health services, is increasing by $500. And the Behavioral Health Administration is working with us on increasing the PACT grant for state fiscal year 24. So even in our current state fiscal year, we're expecting this to come through. And there would be an additional PACT peer support specialist and an additional vehicle for that person to use. So that would be another person in the field for PACT, someone with their own lived experience supporting folks in the field. The one decrease that we're seeing in our budget is under the STEP grant. That's our tobacco work. A decrease of $43,000. That's because there have been statewide cuts in those grants. And as well, Eagle County had been kind of underneath our grant and our services, and they've separated out. So there's two reasons for that decrease. And then just talking about in 2023, that health promotion coordinator started in July, so that was an increase in our budget. It's funded, that position is funded by three different things: that CDC infrastructure grant that we talked about in the increase, an ELC epidemiology and laboratory capacity, say that 5 times fast, and a homelessness grant. And then increase also reflecting that additional PACT planning and data work. Of course.
Francie, is that okay? I have a question. A couple questions. The child fatality prevention system is being mandated by the state, probably from the Child Fatality Committee, I would think. How does that affect your work? Does it track all nature of child fatalities?
So it's generally specifically looking at accidental deaths in children, anyone under the age of 18 in the county. There would be a child fatality prevention review to determine if there is more that we can do on the community level to prevent similar deaths.
And don't we have a committee that has to meet related to that?
Yep.
Do they meet ever?
Yeah. They only meet when there is a child fatality to review. So fortunately, it's not very often.
Yeah, that's what I was going to ask. What is the incidence of child fatality here?
We've had maybe one or 0 per year for the past
Few
5 years.
Mm-hmm.
And so, while at the local level, we fortunately don't have enough deaths to find any trends or what's happening, but all of those reviews, they take and they roll up and they look at the state level to determine if at the state level we can identify any patterns or areas where, to Jenny's point, we could be doing more to prevent certain kinds of child fatalities.
Thank you.
I believe that's it for me.
Oh, and then I wonder, how's your experience been with the transition to the new behavioral health administration? I'm curious as to your input. And
Do you want me to take that, or?
You can start.
I honestly have not seen a big difference in the way that we've worked with them in the PACT program. We have the same grant manager that we're working with, program manager at the state level. So I haven't seen any huge changes, particularly in that program, which I believe is our only grant from Behavioral Health Administration.
The program level, at kind of the policy level, and some of the rulemaking that we're seeing come down. The Behavioral Health Administration seems to be actually putting in place more barriers to providing the services that we need to provide in the rural community. So we're just still kind of waiting to see how everything shakes out.
okay, I'd love to understand that more, and you and I can grab the coffee and dig in that. Just that was a goal to avoid.
Yes.
With all this. So I just, as the legislative session tees up, it's always helpful to think, like, what are our local stories when
Yep.
legislation comes forward to clean those things up? Would be helpful to get more detail from you all. Thank you.
Okay, environmental health budget. Again, Kurt Dahl, environmental health manager. So environmental health is not only the environmental health department, we also have the epidemiology and emergency preparedness departments under the environmental health department. So you'll see a number of priorities for us that fall under all three of those categories. Really, when we broke this up, we thought about surveillance, partnerships, and then again, environmental health, a lot of times we're in charge of regulatory issues or regulatory programs that require administration. So a lot of the regs we have to be updated, things like that. So you have this regulation plan and process revision as well. For surveillance, I think you're familiar with the airport and the air quality studies going on there. We're working with them in their request for qualifications, and then both the greenhouse gas and criteria pollutant programs that they're looking at putting in place out there, as well as questions around the larger area in the county that will come at a later date. So we're working with them on that. And then we have a PM10 contract with the State Health Department. We were in non-attainment in the late 80s. We've been in attainment for a while to where our contract or the program itself is set to expire at the end of this year. That doesn't mean that the program itself will just go away. It's just we need to now come up with a new program that talks about how we're maintaining that level. We need to work with the EPA and the State Health Department on what that looks like going forward, and the City of Aspen, since the most of the former non-attainment area was in the City of Aspen and then the surrounding areas. So we have a lot of work to do in the coming year on that.
I'm assuming that's particulate matter? or something?
Particulate matter, yes. PM 10 microns or less. And then there's also PM 2.5. And that will be one of the discussions that we have. We were out of compliance with PM 10, but we think that PM 2.5 is important, and including that in this, whatever plan we have moving forward will be a part of our discussions with the state and EPA.
Are there regulatory standards related to 2.5?
Yes, there are. They're part of the ambient air quality standards the EPA has.
Do we meet those?
As far as I know, yes, we haven't been in violation of those.
We have never been in violation?
I won't say never,
In the 90s we
but
were,
there's
weren't we?
an aspect of being in compliance, and you can be out of compliance. And the ambient air quality standards are really strange. It's something like you can be out of compliance 2 times within a 3-year period, and when the moon is blue, and so there's an aspect of being out of compliance. If we had been out of compliance, we would be in a program to maintain it. We're monitoring only for PM10, but the city does have on the Yellow Brick Building, they co-locate a monitor as well that does both PM10 and PM 2.5. My understanding is we've not seen a violation of that PM 2.5. They're different sources. So PM 2.5 is more like smoke, whereas dust from sand. That's why we don't sand the streets in Aspen, because the dust from that's more associated with PM10. So those are the pieces that we would look at regulatory-wise in terms of what's contributing to creating those issues.
I thought we were out of compliance in the 1990s.
We were, but then we had a program. We did both regulatory pieces where we've limited the sources of PM10,
like
and then we've
taking
been
away
monitoring
fireplace
since,
permits.
right? Yeah, and so, but we've demonstrated we've been in compliance since that period.
I see.
Since we've had those, and so that's where this requirement is sunsetting at the end of this year. But that doesn't mean, again, it will go away. It just means we'll have something new and different going forward.
And just to connect some dots to an earlier conversation, some of our road paving projects and such were also part of addressing that non-attainment.
Reducing the dust.
Yeah.
Yep.
Are the 2.5 standards good enough for protecting health? Or is there a different goal that might be worthy of discussion?
It's a great question. I don't know that I know how to answer that, other than that's what the research says. I think there's a lot of discussions around particulates smaller than 2.5, ultrafine, which are 1 micron or less. The challenge there is that is new enough, and the technology is there to measure it, but we don't understand. We're still doing research. We, the EPA, others, not the department, are doing
you
research.
and your field,
Yeah,
your
yeah.
cohort.
Okay, great. I'd love to. No. Yeah, our field is still doing research to understand more about those health impacts. I think there's a lot of preliminary pieces. I think we've seen some of the discussion with, again, the airport and some of the papers that they've produced, but there's not a standard that the EPA has set yet. And so there's this catch-up of, we can measure it, but what does that mean?
Yeah, really.
That we're still, and the EPA doesn't exactly move very quickly too. So
Do we have do we track our incidences of asthma?
that data is available, although I don't know the quality level, because that's an individual diagnosis. And so if it's in a medical record, I don't know if the state's able to track that, but those are pieces that I've seen some data, but I don't know the thoroughness of that data. I know we talk about things like when we have smoke days. I was going to come back and bring up that example with climate change. One of the questions we have is, how does that impact our community? But there's not a great record for, if you have asthma and you use an inhaler, that's an individual piece. And so understanding that data would also be a really great thing, but then that means people are tracking it, or how are we tracking it? And I don't think we have access to that level either. But it would be, that would be a next generational piece that would be interesting to start to track that.
Right, okay.
Well, if we restrict wood fireplaces because of concerns about particulate matter, then aren't we increasing the burning of fossil fuels to, I mean, not all houses balance those. In mine, they're definitely balanced because my fireplace is a major source of heat for the house, but I know that's not true, especially up here. But in places where you can't have a fireplace because of particulate matter, so therefore you use your boiler more, so then you're emitting a different kind of pollutant that may not be particulate, but you know
Has
what I'm
different
saying?
impacts, yeah. But back when we changed these rules, climate change was a new and didn't have the attention, right? But nowadays we know that, and so it may be that instead of putting a gas fireplace in, you're putting something that's either a heat pump or electric. So you have to move along as we understand more about the impacts we're having on the world. You know, we focused on the PM10 because there were times, and this was before my time here, that you could go skiing, go up the lift, and Aspen would be in this sea of smoke, and yet it was a beautiful blue sky day once you got up the mountain a little bit. And so addressing that issue was part of that. But now we have another issue to address, and that has to do with climate change. And so, you know, we'll have to shift that scope too. And we don't want to go back to burning wood, but now we need to find other alternatives, knowing that, you know, burning fossil fuels isn't the answer either, or we need to limit that to the best of our ability.
My electric fireplace requires me to turn my gas heater on much less frequently.
Yeah. Well, mine's wood.
I have an electric fireplace.
Yeah.
So, okay, so communicable disease surveillance, one of the pieces that we're working on with partners is, again, based on the lessons learned from COVID, creating a more robust system there so that we're, you know, having communications. The ideal would be between providers, between the, you know, school nurses, between public health, so that we're conveying information around what we're seeing going around that's communicable disease. You know, norovirus. There used to be, when I worked in Teller County, a lot of times the school nurses were working with public health and telling them what they were seeing in the school, and we're working on those pieces as well, so that, you know, if we have questions, we're able to say, you know, here's what the school is seeing, or here's what providers are seeing, just to help inform others as to maybe where they can be looking for testing. Again, it's that population level, not the individual level, but using that information to help inform. And then mosquitoes. So we've periodically done mosquito surveillance. Earlier this year, we saw a probable case of West Nile, or we saw a case of West Nile in a person who had been living in the community that likely it was transmitted here. That would be the first time. West Nile is spread through mosquitoes, and there are a number of other different communicable diseases that could be spread through mosquitoes, and understanding that mosquito population is an important piece of understanding what risk is. So we want to go back and do some more additional mosquito surveillance in this year, or I'm sorry, next year, probably the following years, just to look at the different species and see what's changed, what hasn't changed, and understand, and how to then communicate that risk to our public. Understanding if, you know, we do see the species that spread West Nile more, protect yourself from mosquito bites, doing that educational piece then.
Doesn't the county spray for mosquitoes in areas?
There's one mosquito control district that I'm familiar with in East Aspen. They don't spray, to my knowledge. They use what's called BTI, which is it's actually targets the larvae of mosquitoes and actually kills the larvae, and those are put in the water with the larvae itself, so it's not spraying. I don't believe they
in the water?
spray. Yeah.
You mean like standing water? Or?
Yeah, like standing water. Yeah, so that's where mosquitoes actually breed, is in the standing
right.
water. So, and that target's very specific to mosquito and blackfly larvae. We were a research area back in the 80s when they first came out with this product. And then East Aspen is the one place I know that's doing that. We do have some private entities that are doing mosquito surveillance, and they're sharing their data with us so that we have a little bit of that information, including East Aspen.
Is that easy enough for a basic consumer to do?
Yeah, when West Nile was first here, you commonly saw it in like agricultural cattle feed. A lot of places were putting them in water tanks for cattle, things like that, just to ensure mosquitoes weren't breeding in those. So it's something available to consumers. I don't see it as common anymore, but I know you can still use it. And then if you have places where you can't drain water, that is our recommendation if you're concerned about mosquitoes on your property.
Okay. That might be interesting to do an education campaign if the West Nile,
Yeah, if we
population
see the risk,
increases.
we think
Yeah.
it's increased, I think that's definitely a piece of understanding how you can mitigate the mosquito issues on your private property.
There was something out there this year about that.
And the state, we had a high year in the state with West Nile
Well, I thought
virus
it was
in
in
general.
Picking County. I thought it said
We may
there was
have,
wasn't there a release that there was a
We-
case and how to
put out that
prevent from
release.
getting
We had a
mosquito
press,
bites?
yeah, that we had a case, and we're encouraging folks to take precautions, but it wasn't about the. I think it's a bacteria or something that actually gets to the larva, if I remember
No,
correctly.
yeah, it was just
Yeah,
about
yeah.
how not to go out at dawn and
Right.
dusk. And
Yeah,
yeah,
yeah.
that was part of our media release when we had that, but it was more around personal responsibility,
Right.
dawn, dusk, wear mosquito repellent, long sleeves. Not as much about the property piece, where draining standing water. If you do have standing water, you can use BTI, which it's a bacteria that targets those species. So, so we're looking at doing some mosquito surveillance this year.
I learned so much with
Okay.
you all.
This is Steve. Could
What'd you
I
say?
comment here?
Said I learned so much.
What'd you say, Steve?
I was thinking that in Palisade, where the West Nile mosquitoes were prevalent, also crickets were prevalent down there, and now we are getting crickets up in the Roaring Fork Valley. Would not surprise me at all if we were getting some of the West Nile mosquitoes in the Roaring Fork Valley also. I'm glad you're continuing monitoring that, and I think we'll need to keep doing that for all, clear into the future.
And with climate change, we anticipate that we'll see those changes. I know Larimer County did research, and those mosquito species didn't live above 6,500 feet where they were. So, but we expect to see that change as we have more nights that are warm at night. So, I try to get through the rest of these really quick. So, immunizations. We have data from the state now on childhood immunizations. So one of the things we're looking at is partnerships with how we can increase those rates. We actually were doing better than we originally believed pre-COVID when we were looking at this, but there's still people who have not had their children immunized. And so how can we then encourage that and move forward and working with our partners there?
Are they tracking the RSV shot now as well? Do we know?
Immunization. They track it, yes, because the immunization is reportable. How easy it is for us to access that data, I would actually have to check. You're referring to the RSV vaccination that just came out this year, and it's really for children under 8 months and then seniors. I haven't seen data on, or how we might look at that, but again, that's so new, that's something we can follow up on once that program's been established or the vaccines have been established a little bit longer.
Okay.
So,
Great, thank you.
and then under revisions, again, we have the OWTS program, which is septic systems. The state's going through and starting their regulation changes, and so we'll be part of that. Smuggler, again, Jordana mentioned as Tom retires, we're looking for an air quality specialist. But in the meantime, Tom and I are working with the EPA to try to streamline some of the processes we have there, digitize, trying to come into the 21st century with data and accessing data online and not storing physical records. And then trying to do things like we have an annual letter that goes out, emailing that instead of physically sending out a letter. Some things that will help with time management, and especially as Tom retires and Brian and I both take that program over, what we can do to minimize the time we're spending on it now so that we're just spending less time later will be a huge help.
So is this going to go on forever?
Smuggler? That is the requirement. It goes into perpetuity. Most of that comes from the fact that this isn't a spill, right? So this isn't like somebody had a spill and we can clean up a spill to a previous place where the ground wasn't contaminated. This is a naturally occurring. So I think I have on the agenda in November some time to come back and talk a little more specifics about that, because I know that's been one of the questions.
Great.
And we've been talking with the EPA about, what does that mean? Because I think there's been that question. So
Okay.
we'll come back to you with that. As Jordana mentioned, emergency response. We had a lot of lessons in COVID that we're learning. We need to update some of our emergency response plans, not only with just information, but things that we learned during COVID. And John had a really good point with vulnerable populations, and a lot that we learned with vulnerable populations through COVID that we can then incorporate into our plans. And then the public health improvement plan, again, Jordana talked about climate change and health. And again, looking at vulnerable populations, I think another really good example there was smoke. We know that as with drought, we have more wildfires. We see more smoke in the valley in general, and we will continue to see that. When we think about how to deal with that, one of the things that has come up is similar to a heat shelter, it's a clean air shelter. We know that smoke impacts populations disproportionately. We have asthma, COPD, other respiratory illnesses. So if we're thinking about equity, and if we want to put something like a clean air shelter in for people like that, location becomes an issue. Understanding what the populations are that are being impacted, and then understanding what, as an example, a location might be where that serves that population best. It is along a transportation corridor. If most of the population we have impacted is in Aspen, putting it at Woody Creek doesn't seem to make sense. So asking those questions about who's impacted and how we can best then get them the ability to utilize something like this is really thinking about equity and how we can do that. Is that
What
a
is
better
a clean
example
air
for
shelter?
you?
What does that look like? Is it like,
So typically it's
I mean, you take a
seen-
building and you,
it's a building
filter the
typically
air.
with a filtration system so that they're cleaning the air and you're not getting the impacts of the smoke on the outside.
but can you do that to any existing building? I mean, you don't have to build a building, right?
No, you don't necessarily have to build a building. A lot of times what happens is you redesignate it. And I mean, it's an idea, again, that's come up because we've had some pretty severe smoke issues in the past. And so it would be a place where somebody who, like I have asthma, if, I'm being impacted by this and I have nowhere else to go, I can go there, and at least then I have the ability to bring clean air and potentially help my asthma and calm it down if I'm having an issue with
That's
it. So,
interesting.
yeah, school. I've seen it in schools, actually, is the place where I've seen examples where they actually install HEPA filters and say if they can isolate an area like a gym in the school, then they can create that. But again, it's got, the question becomes, if you're serving that population, how do you best serve them so that it's at a time when they need it, it's in a location that can be accessed, all of those questions that you answer, if that's a path you want to move forward with. So, is that,
Thanks. Yeah,
is
that's really
that-
interesting.
Is that preferable to like providing equipment people could put in their own homes, or?
well, again, I think that comes back to the population that you're trying to serve and the reusability. First thing I have is costs. What does that mean in terms of costs versus an in-house versus a building that, you might be able to serve more people? Those are the questions you ask, though. Does it make more sense to do something like that than a shelter? And a shelter is just an idea, but it's an idea that you're starting to see other jurisdictions at least looking at more seriously because of the smoke impacts, and we anticipate that will be something we'll be dealing with climate change through the years. We got lucky this year and really only had impacts from a fire early on in the season in the Canadian fires, and then later in the year with a control burn. But in other years, we've had
We
more
had
severe.
smoke from another community a while ago.
Yeah, the Canadian fires came down and impacted us for a little bit early on in the year. So
That was from Canada?
that was from Canada.
I didn't realize.
In
that.
years past, we've had smoke from Oregon and Washington fires. It's something that it's not a small scale anymore. It's a much larger scale that's impacting us. And that's why, as much as we can make efforts around drought, those impacts we're going to feel. And so how do we help people with, issues like that? That's why, a clean air shelter might be a good answer for that, knowing that we can't necessarily control that we have fires in Oregon and Washington impacting us, that we can't control that. So.
Francie, this is Steve.
Okay, go ahead, Steve.
Kurt, I was thinking that perhaps some kind of a program to get a bulk purchase of HEPA filter, air cleaner systems for people's houses could be in order. We use one right in our bedroom. So when it is a smoky season, at least for, a third of the day, we're in our bedroom asleep, and we can be breathing clean air in there, even if it's really smoky outside. So that could be something for the, disadvantaged population to get, both purchase some, the filters themselves are expensive when you have to replace them, but maybe we could make a cost-effective kind of thing that would help people who don't have the money to be purchasing that stuff for themselves.
Yeah, and that's another option. I think those are, again, that's one of the questions you ask. How do you better serve the population that you're trying to target? Is it individual units that sit in a sleeping room, or is it a shelter, or what? And I think those are the questions to ask, but that's certainly a possibility. I think it's just money, right? So, all right, next slide, please. Okay, so changes to the budget, not a lot. We have a slight increase in revenues from a few fee changes that we had with the OWTS permitting system. Not anticipating a lot there, though. As Jenny mentioned, we also are seeing the ELC 2.1 grant supporting some staff in environmental health, as well as the persons experiencing homelessness grants. So both of those are an increase in revenues. And
Sorry, I'm curious about that last grant, given that Human Services does a lot of the homelessness coordination.
This is specific to COVID and looking at outbreaks potentially with the homeless. Excuse me. We're working with Recovery Resources. They also have a grant from CDPHE around surveillance of people who are utilizing their facility and doing temperature sweeps. And so we're working with them on setting that up, and then potential testing as well. Okay. And then if there are outbreaks, helping them with understanding the outbreak and how to control it. But it's very specific to COVID and respiratory illness.
Okay, thank you.
Mm-hmm.
And what does ELC stand for?
Early epidemiology and laboratory capacity.
Oh, yeah, right.
Sorry.
Okay,
Yep.
thanks.
Yep. So that's really around, again, testing and surveillance for, again, COVID specific or respiratory illness specific, really, because we're shifting into that role. And then expenditures, potentially there's an increase. And again, that is around the air quality specialist. If you remember in the priorities we have this year, a number of issues around air quality. So we're looking for that air quality person. That's contingent on Tom Dunlop, who's our smuggler manager, retiring. So if and when he does retire in 2024, this would be an increase to onboard that person. Any questions? I believe that was it.
Okay, so that brings us to the budget and 5-year plan for the Public Health Fund. And you'll notice some similarities here in the Public Health 5-year plan and the Human Services, where under the revenues, that intergovernmental line is by far the largest. They do rely on grant funding for a number of their programs. As Jordana mentioned, what's provided by the state is clearly not enough, but that is a significant part of their revenue. Under the taxes, that would be the tobacco tax, the first line of the revenue. On the
Wow, that's a lot of tax for cigarettes and stuff. There's just 4 locations, right? They must sell a lot. What is the tax rate on cigarettes? Is it super high?
Isn't it like $3 or $4 a pack or something? I mean, it is super high.
I don't know.
It is high, but I don't know the number.
Wow.
I think we set it at a level, and then it was to naturally increase over time.
So that would translate to like 50,000 packs of cigarettes. Wow. Amazing. Sorry to interrupt.
I know. On the expenditures, you'll see on the salaries and wages that actually is going down. As Jordana mentioned, they've coming down to this level of employees after COVID and having all of the extra COVID staffing. So you do see a decrease there. And the professional and technical services is where the bulk of the budget is for this fund. That includes all of those program dollars, whether it's for mental health, immunizations contract, tobacco cessation, the co-responder, the harm reduction. Most of these programs are budgeted within that line item. Just like human services, the public health fund requires support from the general fund. So we've got a 1.1 million in a transfer from the general fund. The healthy community also supports public health with about 840,000, just a little bit less. And then public health also receives a grant from the Healthy Community Fund of about $305,000 per year that supports the mental health programs. Specifically right now, 2 positions, one in human services and one in public health. The Public Health Fund maintains a healthy fund balance. You see some years where we are drawing down fund balance. It's a little bit intentional right now because it does still allow a healthy fund balance at the end. And the mental health dollars are included also in their total fund balance. Questions on the 5-year plan and budget?
Not for me.
No,
Any
I
questions?
do have a question. Is there any coordination contemplated for the emissions program and the noise program that's being envisioned at the airport?
I mean, I know that both programs exist, or there are requests for qualifications, and I'm working together with the airport on that, as well as CJ, so there's coordination there. Are you thinking additional coordination, or?
Well, I guess I'm thinking, is there going to be one person who's sort of managing both goals?
That I don't.
It depends. The airport emissions studies tend to be fairly specialized, particularly as they relate to some of the modeling requirements and such that we have. And so we haven't gotten to that point yet to see if it makes sense, because the folks who do the airport emissions tend to cost a lot more too. And so whether it makes sense to bring them on to our general it would probably be the question, Kelly. And I know we're coordinating with CJ and Kurt as we're going through the air quality to make sure that we're all speaking the same language and able to interpret the results for the community. Similarly,
Sorry, who's CJ?
I'm sorry, CJ Oliver is City of Aspen.
Oh, got it.
Yep. Environmental health,
Environmental
right?
health,
Yeah.
sustainability
Yeah.
director. Yeah.
So we're coordinating to make sure that we're linked up and aiming towards the same goals. Whether it's the same expertise or consultants, we're not there yet.
And what is their role in the airport, CJ's department's role?
It's they're monitoring air quality in general, and so we're not a particular role in the airport, but we're trying to stay coordinated since the city's monitoring air quality, the county's monitoring air quality through the health department, and the airport is. We actually haven't had a lot of coordination in the past between those 3 entities, so we're trying to create that now.
Right.
That sounds like a good
So are
idea.
you spearheading the airport program?
No, I'm participating just like CJ is, and that's more around our expertise. And then we're providing the expertise for the airport. We've been working with Dan, and I forget who else was actually coordinating that, but they've included us in those pieces, so, yeah.
Steve, do you have a question?
I haven't fully sorted mine.
I just saw his light go on.
No, I'm good. I'm good, Francie. No
Okay.
questions.
Okay, so now I'm more confused than when I started, but that's okay. I thought we were looking at bringing on a person who was going to be sort of looking at the air quality stuff as well as how that relates to the airport reduction goals. Am I
That's-
understanding that?
That's yes, that's correct. But it's a different modeling when you're modeling the airport emissions versus
Noise.
measuring the noise and or the particulates that are being collected by the environmental health.
Right.
Okay, so is the person we're bringing on going to be more focused on general air quality in the county rather than specific air quality related to the airport?
There's two requests for proposals, so there'll be potentially two entities. So one will be focused on air, one will be focused on noise. Could it be the same entity? Maybe. That depends on, at the end of the day, who we select.
But who's our staff that's going to manage that
It'll
or deal with those results?
It'll be a contract. If it's through the airport, it'll probably be through Dan Bartholomew's office coordinating with environmental health with both the city and county.
Okay.
So my department will essentially act like a consultant for the airport.
Yeah, yeah.
Right, and that's part of the request for the air quality specialist is actually their, Brian and I have some knowledge, but, you know, we're this much, we're air quality specialists will give us much more. And again, we'll be as a consultant with the airport, working with an outside consultant on the project too. Does that answer your question?
Okay,
Does
so
that
not
help?
somebody in-house, and that would take up whatever Tom's time currently
Right.
is as allocated.
Right,
I
correct.
see. Okay, thank you.
It's not too often that you see such a big change in revenues. I mean, that's $500,000. That's pretty significant overall.
Yeah, in 2023, there was a grant from the Rocky Mountain Health Institute for $100,000 that's in there. There were still some COVID grants. And so as we see the staff coming down, we also see grants going
Right.
away.
Okay. So with that answered, I'm okay with this.
Thank you.
Okay.
I think, Steve, you're okay with this?
Yes, I'm good with it.
Okay, we will pick up after lunch with the library. We were able to take a little bit more leisurely pace this morning, but in the afternoon we'll pick it up just a little bit and move through a number of different departments.
I think that's your polite way of asking us to stay on topic.
That's why she gives you the sub-agenda. This
We'll
is the
try,
agenda
Connie, we'll
to
try.
follow.
Well, thank you very much, guys.
All right, thank you.
Thanks, Bonnie.
Thanks. Okay. We will be back at 1 o'clock, Andorra. Welcome back to the Board of County Commissioners work session on Tuesday, October 17th. We are still in the midst of budget, so I will turn it back to Connie.
Okay, we're picking up with our livable and supportive community budget presentation, and we have got the library here with us to present their 2024 budget.
All right, thank you. I'm Genevieve Smith. I am the library director, and with me I have Molly Ireland, who's a managerial librarian, and Jeffrey Bradley, who's a deputy director, and they're here to help field questions should they come up, but I'll be doing the majority of the
Well, welcome to all of you.
Thank you. So as far as our org chart goes, I wanted to display that the majority of our staff are in these 4 key departments, and then our administrative staff sort of leads from the middle, supporting everyone in any way possible. Our 4 departments at the library are adult services, circulation, technical services, and youth services, and the majority of our staff are cross-trained in different departments. As we're open 7 days a week and things come up, people need to be able to be a little bit nimble there. So those are our major departments. And then our 4 key areas that I just spoke about, the focus for each is, so adult services, they focus on collection development and outreach and programming for the community. Youth services focuses on community partnerships, early literacy, and supporting kids as they're going through school, and then families throughout Picken County. Technical services, their core focus is a beautiful and organized and well-maintained collection, making sure things are standardized and always able to be found on the shelves where they're supposed to be. And circulation, they focus on sustainable and economical resource sharing. Each library card holder has access to over 30 million items, and circulation is the department that makes sure that those resources that are coming and going get to the people that ask for them and are accountable. Our priorities in 2024 continue to be community building, having high quality, accessible programming for the whole community, maintaining our beautiful library that was remodeled in 2016, making sure it's a comfortable place for people to come in and work and gather and learn and recreate as needed, to provide resources and services for education, enlightenment, and recreation. We consider the library to be a pillar of our education system. After grade school, high school, the community college, the library is here for lifelong learning. And to help bridge the digital divide, to provide access to information for people that may not be able to afford it at home, or they don't have the knowledge base to navigate it freely. Our library staff are all trained and are great with technology and are happy to help.
That's an interesting picture on that page.
Well, that was the bounce house at our summer reading party.
Okay.
I like the colors, yeah. Continued priorities are staff development. So we're proud to say that we have 7 staff members pursuing master's degrees in library science in 2024.
That's awesome.
We currently have 8 staff members with existing post-secondary degrees. And so out of a staff of 24, that's a big majority there. And then we have a staff member that's enrolled in Roaring Fork Leadership and another in the Certified Public Manager program. So I'm really proud of the work that staff puts into their education and making sure that they keep up with it. We're also prioritizing staff retention and promoting professional development opportunities fairly for the entire staff and allowing them to choose and pursue their own professional interests. The interests of the community change and the needs of the community change, and we need staff to be able to change with it and be able to help as needed. And also flexible schedule opportunities for staff. We have more than half our staff commute from outside of Aspen. So,
While we're on staff, do you have bilingual members of your staff?
that is a priority for us. We often hire them, and then we just lost our. We had a staff member that moved away because of housing reasons, and she was our. So, the next time we hire, that is one of our priorities. Yeah, absolutely.
And can you choose taking Spanish as a professional development opportunity?
Yeah. Yep.
Okay, thanks.
Yeah. and I think an important one for Yancy. Proposed changes for 2024. So 2023, or 2022, pardon me, was the first year that our digital checkouts surpassed our physical checkouts in the library. And because our library is, online 24 hours a day and accessible, we are prioritizing that, the digital access. So we're increasing our budget for ebooks and e-audiobooks. We want to maintain a holds ratio of about 4-to-1, which is what we do for a print collection. So we've upped that budget. We want to maintain our high-quality online resources like Rosetta Stone, other language learning things, investment tools, stuff like that. And then increased outreach to residents in Redstone, Woody Creek, and Snowmass Village.
What does that look like?
Doing library card signups, doing trainings on digital databases, being there in person to answer questions about our online resources, and because we require an ID for people to sign up for a library card, sometimes we have to meet people where they're at. So they don't have time to come into the building. So, yeah. And also bringing programming to those places, story times and stuff like that. So building electrification. The library board recognizes that this is our responsibility, and after the county electrification study completed in 2023, we sort of know where we're heading with that. The county, what I'm hearing from the BOCC is that you support prioritizing the library as our current systems are overdue for replacement. And our goal is to promote sustainability and community health and safety in Pitkin County. So we're happy to follow that directive. We also have some equipment that needs to be replaced that's on our replacement schedule, such as our self-check kiosks and our security gates, also some lab items, community and meeting room equipment like microphones, things like that. So that's on a normal replacement schedule. Any questions about this?
Well, just on the electrification, I know that Greg and I have talked quite a bit recently about hearing rumors that you were going to replace the boilers there with gas boilers. And I don't know whether I should wait and talk to Jody about that, or is it your understanding they'll be?
That's not my understanding.
Oh, great. What's your understanding?
Well, my understanding is that we're doing a full electrification of the building, and that there's some opportunities there to do full electrification, a hybrid, maybe other things, but.
So the library board
Yeah.
conversation was around funding electrification of the facility. When we bring the project back, one of the alternatives, both to have a backup power source, because right now we don't have necessarily storage or an alternative power source should there be an extended electrical outage or such. Until such time as there's probably a microgrid and more off-site storage, so be prepping the building for that. But there won't be that kind of backup right away, and so that will be one of the questions when we bring the electrification project back to you is, do you keep a gas boiler available, basically, in case there's as backup heat, particularly because of some of the collections that are stored there. So that'll be part of the conversation. So that may be what got translated to you in that conversation.
Great, thank you, John. Yeah, Kelly?
Yeah, I'm just wondering, it's great to see you all. We
Hi,
haven't
Kelly.
gotten the full scope of the building electrification study presented to us yet. So for John, I guess 2 questions. When are we going to see that? Do you know? And how, as we are moving through the budget, how are the elements of that plan showing up in the budget?
I can answer the budget question, and
Yeah.
John will answer the rest. That we just have placeholders in the budget.
But is it for everything that showed up in the electrification
We have
study?
placeholders for 2 buildings for this coming year in 2024. Others would be outside of the scope of the 5-year plan.
Okay, and
So
that's,
it's just budget placeholders, and
because
then
I see a
waiting.
bunch of them under, oh no. So the ambulance facility and the library.
The
Health and Human
Human
Services.
yeah.
Services and the library.
So we moved the electrification study to bring APSHA in a little bit earlier, and it is looking like probably later November before we'll get the study back in front of you. The study itself had identified just under $24 million for 10 county facilities for electrification. That's in today's dollars. That's not escalated over time, depending on what happens with construction, inflation, and such. We chose two facilities, the library and the Health and Human Services building, for a couple of reasons. One, both have infrastructure that's aged out. The library in particular, we're concerned about the ongoing reliability of those boilers. We got them a little past replacement. Human Services is in the same. Those boilers have been in since 91 and have reached the end of their useful life. They're also two of our most public-facing buildings, and they also have our highest gas consumption, per single buildings outside of the airport and outside of these three buildings combined, which are, on a common system. But they had the biggest kind of greenhouse gas benefit, along with needing to do it. They're also, by being both publicly facing, we think we have the most to learn about the commissioning challenges and such of a retrofit.
Okay, that's great. Thank you.
And when will sidewalks come back into the conversation?
When we bring it back, so right now we're proposing to budget the full scope, so it's all boilers. The board would have an opportunity to roll that back if you wanted to, roll back on the snow melt or think about hybrid. You're going to have an opportunity to do that. That would fit within this budget. We're also presenting for grants through Energy Impact, and then Governor's Energy Office just announced a new round of grants for electrification. And
Before the end of the year?
Yeah, they're due actually they open up this week, in fact. So we're planning on putting in for those grants too.
And so it'll come back under electrification or under the full budget? Under the electrification proposal?
Yeah, under the full budget right now is the budget. If you reduce the scope, we would anticipate just spending less than budget. And
okay, great.
Now, if we get these grants, that may also define some of the scope that we're required to do too.
Okay, thanks, John.
Mm-hmm.
Looks like it's on to you.
So this is the library 2024 budget and 5-year plan. Just a few things to point out on this budget. The library's main revenue source is property tax, anticipating to bring in about $5.2 million. Library is restricted, most of its mill levy is restricted by Tabor. Under the intergovernmental, we are anticipating, and right now it's just a guess, $300,000 in a grant for electrification. That's just a placeholder right now, and we'll adjust accordingly when we see what actually happens with the grants. On expenditures, of course, salary and wages, and most of the line items are just the normal operations of the library. We did include extra electricity costs should it be the fully electric version, so we have a placeholder for that in the budget. The library collection is one of the main areas in the library budget, as Genevieve talked about, maintaining that, whether the ebooks or the physical books and so on. Further down under the property, you see the $2.5 million. 2.5 of that is for the electrification project. Plus, there's a little bit else in the machinery and equipment for some of the other replacements that are just needed for the programming. the transfer from other funds, we are anticipating a $500,000 transfer of REMP funds to support part of the cost of the building electrification. And that will also come back to the board during our REMP budget discussion. So because we have such a large capital project this year in the budget, we are looking at a deficit of about 1.3 million. That's a one-time spend down for the capital cost. That would leave the library with about 2.2 million in their unassigned fund balance. Most of the years, there would be an operating surplus, not a large surplus, but still on the surplus side. In 2028, you notice a larger deficit, and that's because they're planning ahead with a placeholder in the budget for a refresh of the current building. And that may
Yeah, recarpeting, repainting, reupholstering all the furniture in that building.
Wow.
Any questions on the 5-year plan?
I have a question. I think it might be a John question. Under the salaries and wages and then the employee benefits and health insurance, this may be an old-fashioned assumption, but I thought that health insurance and benefits were usually around 20% of income, and then and went on top. This looks more like 30%.
That
33.
your math is good, Francie, and it is. With retirement, with health insurance, all our benefits, we are closer to 30% load now. And really what's been happening over the years is that particularly health insurance, we've had some good years of bending the curve, but over the decades, health insurance has increased at a faster rate than our general spending and our revenues in particular. We also made some adjustments to increase the percentage going into retirement. And I'd also note, versus other organizations that you may have been part of, we are not in Social Security. And so our retirement contribution base is 13%, up to 15% of county share because we have a 2% match in there too.
Yeah, okay.
So,
It's a lot.
mm-hmm.
It's a very generous county.
Mm-hmm.
Thank you. Yeah, Kelly?
Yeah, where are the discussions related to the Snowmass branch with the library board?
Yeah, so the library board is choosing to prioritize electrification and seeing how that sort of plays out, what model we decide to move forward with per your guidance. And Snowmass Village is just temporarily on hold until we see how that happens. So that's not in our 2024 budget.
Okay. And it's not anywhere in our 5-year or capital plan at all?
We have to see how much we're able to contribute to that project. And with our current revenues, we would have to probably find some different revenue streams before we pursue that.
So there's a few challenges there that I think we ran into. One, doing both electrification and the Snowmass project at the same time would have put the fund into a negative position. And we also were encouraged to be thinking about a larger scale project versus the smaller scale project that we had originally brought forward. We couldn't make it with the smaller scale, so in the larger scale project was encouraged, I think, at the joint meeting. We really had to take a step back. And so I don't think we're still going to look at opportunities to partner with Snowmass. It's always great in this valley when somebody offers you land to do a project to try and figure out a way to take advantage of that. Right now, I think we will see how our grant proposals for electrification come through and whether we are going to be open to throwing any more REMP at it. We also probably need to think about how a little bit more how the operating costs would look in partnership with Snowmass and what our service models are. We may not be able to have the full service model. So I think the intent is to still look for the opportunity to move forward, but in a position where we are now with budget, a choice had to be made that kept the fund intact, and it seemed that both this board's priorities and the library's board's priorities matched up, that we should do electrification first and continue to look for possibilities to partner with Snowmass to provide those services in that community.
Yeah, well said. Thank you.
And I really like Greg's push for looking for private donors. I do think that is a place where there might be some potential for, having a library in Snowmass named after you or just being involved with it might be really appealing to people. I don't know what that would look like, how to find that, but.
Well, typically that would be a campaign. I think that may be a conversation that I'm not sure the library board was anticipating that kind of effort, and if we are, maybe a conversation we need to have, because that needs to be a really intentional effort led by somebody to make that happen.
What was the proposed cost of the smaller project? Do you remember?
Do you remember off the
Well,
top?
if we scaled it down to 2,500 square feet, our cost per square foot was coming in around 1,700, so that's about $4.25 just to build. But the operating cost is really where it was starting to impact us.
Okay, thanks.
And
Francie,
Yeah, Steve,
I don't think you can see me on the screen.
we cannot.
I'll just have to jump in. But I was going to bring up that idea of the private donors. Just like when that we were doing the major remodel and expansion of the library, there was a capital campaign, and the library board was really the ones heading that up. I think we should leave that up to them. If they want to pursue that, then they should bring it to the commissioners, and we could decide, our level of support or what we need to do. But I personally contributed when, we were doing the library expansion, and I think we'd have a lot of people in the community who would be glad to participate in that.
Thanks, Steve.
Thank you, Steve.
in the library fund balance, they do have about 1.9 million in a capital reserve. And when the project was originally envisioned, it was envisioned at a scope that would fit within that capital reserve. But obviously with the talk of the building price per square foot, that's nowhere close right now.
It's just changed so much these last couple of years with construction costs. So it sort of caught us off guard, and the library board wanted to be more deliberate and intentional, like John was saying.
But a $4 million campaign in this community is not really that intense, considering some of the other campaigns that have happened. Well,
Any
thank you.
other questions?
Okay, thank you.
Looks good.
Yeah.
Thank you.
I'm
thank you
fine
so
with this.
much.
I'm sure, Steve, you okay with this for now?
Yes, I'm okay with it.
Okay. Thanks for coming in, everybody.
Nice to see you.
Guys.
Thank you.
And welcome to the Sheriff's Department. Hi, Alex.
Hello, how are you?
Parker.
Do you have the sheriff on Zoom? And also Dan Fallon?
I did see Dan on there. So I do have them both. Do you
Yeah,
want to see them both on the screen?
if we could do them both, and also as panelists, that'd be great.
Is this the sheriff's first budget?
This is the sheriff's first budget, yes.
Yeah.
Yes.
Lucky him.
Anything you want to do to?
No, I just was curious.
So I've got Dan on camera.
Thank you.
I guess your budget book isn't as intimidating as a first-time commissioner's budget book.
Yeah.
Is he in his office?
You
No,
can't,
he's,
there they are. There's Steve and Dan. I don't see Michael.
Just got
Just declined my request to promote him.
I'm trying to promote him, and I'll tell him to accept this time.
Unacceptable.
Yeah, you better cut his budget by 10%.
Yeah.
There
Like
you
getting that
Perfect.
motorcycle.
Michael, turn on your pretty face there.
Can you hear me?
Yeah, there you are.
Perfect, thank you.
Great.
Hello, everyone.
Hi,
hello.
welcome.
You can go ahead.
I'm happy to go to the first slide. So we're excited for the 2024 budget. As you mentioned, it is Sheriff Puglioni's first budget process and budget year going through this process, and we're excited about that. A lot of really good input from him and from the staff on new projects that we want to work on. And I'll go through the process of highlighting some of those and then obviously open it up for questions. Some of the, as we've done in the past, our focus is going to be on employee wellness and well-being and our service delivery model, essentially how we provide our public safety services to the community. I think the unique, one of the unique aspects of the Pickens County Sheriff's Office is that although we do have a traditional law enforcement branch in our Uniform Patrol Division, what we do really is more public safety, holistically public safety, from everything from changing a tire or a broken water pipe in someone's basement all the way to more traditional things like having to arrest somebody. So it really spans that. So one of the things that we'll be focusing on next year is an accreditation process through the Colorado Association of Chiefs of Police and also the County Sheriffs of Colorado. And actually, I wanted to give Sheriff Puglioni an opportunity to talk about that process because it was something that he specifically brought to us as something that was important for the 2024 calendar year. Michael, do you want to talk about the accreditation?
Sure, and it's pretty short and sweet. It really checks the boxes that we're following best practices here in Pickens County when it comes to law enforcement and how we treat everyone. It also gives the office and the deputies, and this year we're just looking to get an accreditation for patrol. I didn't want to take on the whole beast of doing the jail as well. That's I think is next year. We're looking to do that. It's something that happens every 3 years. You have to go through the process every 3 years, but the big lift is the first time you do it, which would be this first time. We'd be the second sheriff's office in Colorado to be accredited. The only other one is Arapahoe County. So I'm pretty, once we do get accredited, I'd be really proud of that we're one of 2 counties of the 64 counties in Colorado that would have this badge of being accredited by the County Sheriffs of Colorado organization.
Great. Any questions about the accreditation process or anything?
Does that give us access to funding?
I don't think it specifically gives you direct access to funding, but I'm sure it's something that makes us stand out from other organizations when seeking funding opportunities, especially from the state. To having a third-party, outside, independent entity review policies and procedures and say, this organization is really doing it the right way, I think would probably speak in our favor.
Does it cover all the employees of the Sheriff's Department?
It would just be specifically for the patrol division, so the 26 uniformed law enforcement officers.
Why don't more pursue it?
It's a great question, and I don't know. I'll let you know next October after we go through the process and tell you how
Let me explain it, right?
tell you how arduous it is. And that could
When's
be
your
the
next
reason.
sheriff's convention?
That'll be in
ask you
January.
after.
In January. Moving on down the list, something that we've dealt with for years, and I think everybody across the organization in Pickens County and also specifically law enforcement agencies throughout the state is our efforts and attempts to recruit. It's a different landscape now than it was 5 years ago. I celebrated my 15th anniversary with Pickens County in August, and the recruiting landscape and just the pool of applicants that we're pulling from is just very different than it was even when I started. So we're trying to figure out and think of different ways to reach that demographic. We've recently started doing social media advertising and actually paying for ads through our recruiting budget. We're going to increase that a little bit going forward this year, but also work with
Marcy, to do some videos and really try to get the story of the sheriff's office out to people, and really tell the story of who we are, the people that work here in the community that we serve.
That's a good idea.
Yeah, as part of that is a staffing analysis, is to really take a look at how many FTEs we have, how many people we have working in the patrol division, in the detention division, specifically to ensure that it meets the needs and expectations of the community. Part of this is, I think anecdotally we feel like we need more staff, but I don't think, and the sheriff doesn't think, that that's enough for us to bring to you to say we feel like we need 5 more people. So we want to partner and work with an independent contractor to do a full comprehensive staffing analysis. And it takes into account population, calls for service, current schedules, all sorts of different calculations that essentially says, based on all the things that you have going on in your organization and your community, this is what we think you should have in terms of number of uniformed law enforcement officers and detention deputies as well. So then we can bring to you, and I'm sort of front loading this here, we can bring to you hopefully mid-year next year, potentially, at least to start the conversation about the addition of additional deputies in the sheriff's office.
And are you currently recruiting at this time?
We are. We actually just went through a process to hire a new community response officer, and we have 3 open positions in the jail, 2 of which we filled. We're in negotiations right now for an offer with a community response officer, and the open patrol deputy position just closed on Sunday, actually. So we're going to be going through the final stages of that recruitment process. So although the budget profile indicated we might have 3 positions open going into next year, it's actually looking a little bit better for us as we've started to sort of increase our recruiting efforts in this quarter of this year. Any questions on that at all?
No, just some members are sensitive about position requests mid-year.
Understood. And that's why I think it's important that I think it's important that we come to you with a comprehensive kind of analysis, and not just the feeling and behind it.
No, I
right?
appreciate that.
So,
yeah, that makes a lot of sense. I think particularly with the jail, one of the things I've always brought up in the CJCC is relating staff programming to facility design.
Right, definitely.
So that'll be helpful. Thank you.
The next bullet point down is the Office of Emergency Management. As we all know, Valerie McDonald retired back in August. She's been grateful enough to stay on retainer through the end of this month. We plan to post the position to hire and go through that process of hiring a new emergency manager in the next 7 to 10 days. And Parker is stepped in as the interim emergency manager in Valerie's absence. But talking with Valerie during her exit, and also really looking back over the past few years and the number of projects that we've really wanted to be involved in, it sort of brought to the forefront that obviously our priority is to get a new emergency manager in place and get that individual, up to speed with everything that we're doing. But we feel like we will need to hire an additional, either an emergency management specialist or a deputy emergency manager to augment that position, to allow us to have continuity when one of the 2 goes away on vacation or to a training, or for some reason unable to staff the emergency operations center. So although that's not included in our current request, I just want to talk about that and have that, the opportunity to let you know that probably during 2024 we'll be coming back to the board to have those conversations about adding another FTE to the sheriff's office in that department.
Can I ask a question about
Please.
that? And so how does that integrate with the city's emergency management office?
So the city doesn't have an emergency management office right now. I don't think I'm speaking out of turn by saying that the police department and other offices in the city kind of take various pieces of that role, but the city doesn't have one specifically.
So we're it?
We're not it. We will certainly assist, but we're not their emergency manager.
So
I've urged, and again, I'm not speaking as a turn here either. I've urged the city manager as well as the new police chief to certainly look into maybe a part-time EM that works under the police chief or whomever. I think it really help them out with all the special events they have all summer, all winter, and would really mesh well with our new EM as well, and hopefully that other deputy EM that we'll be looking at.
So, Francie, we also have created through emergency management response structures that are in partnership. And so we have an incident management team that's really run through the sheriff's department with participation or with also Aspen Ambulance.
AVH.
And AVH.
City of Aspen.
Yeah.
Number of individuals.
And City of Aspen that has a coordinated response and a practiced coordinated response to an incident. That then, once the incident starts to move into more of those recovery phases and or the capacities of our first responders have been exceeded, we also have what's called an emergency operations center that's been organized there.
Who's we?
Well, all of us. That's the
Okay.
yeah.
Usually we have,
the
and I
point
was like-
the point that I'm trying to make is we have participation. We have emergency support functions, and they're led by different folks. Some are in the county organization. Some are in the City of Aspen. Some are from our nonprofit sectors. And when we practice events, and part of what our emergency manager has been doing is coordinating and organizing all of these groups so that when we have an event, everyone knows their role and we're working together to address it. And so, you know, a lot of the emergency manager's function is helping all of us understand what our role is, come together cross-jurisdictionally, and try and have smooth transitions from that incident to eventually recovery in an event. It never goes totally smoothly, I think, but we've got a really robust system, particularly for a county our size, and so everyone's playing ball together right now.
Thanks, John. Kelly?
Yeah, I guess I wonder, I feel like we have gotten more formal in our collaboration, particularly due to the Wildfire Collaborative, in many of the various players that have roles in the Emergency Operations Center. So I guess I'm wondering, is there a collaborative opportunity to jointly fund some of the program or a support position? That's what I would throw out there. I'm going to channel Patty Clapper here.
So we have not had that discussion. I would anticipate we need to probably sow the ground for that if we're going to. I think a lot of our neighboring jurisdictions and such view that as a county responsibility and role. But it doesn't mean that there can't be collaboration to build more capacity that supports everyone's needs.
Yeah.
Yeah.
And yeah, I know some of these are more formalized in other parts of the state. I don't know how they come together to
Ours
fund
is
positions.
to fund positions. Yeah, we've done it, for example, with the Wildfire Collaborative, as you called out, that we're partnering to fund that effort, both the mitigation, but also the administration of that program. Emergency management, I have not seen collaboratively funded. That'd be something I could maybe put out on our administrators listserv and see if anyone's doing that. I've seen more like the wildfire mitigation, those sorts of things, but I'm not aware of a emergency management function being jointly funded. So I'd have to research that a little bit.
Okay. And then I thought there was some contemplation of moving the emergency management to county managers.
So
office.
We had talked a little bit about that, and the conversation was short. And it was primarily it was primarily short because our charter, I think, is fairly explicit that that function sits under the sheriff's department, and so what we did talk about though was that collaboration, because that handoff, I think, between those functions that we were talking about, the incident management response to the emergency operations center functions, the emergency support functions, particularly as it gets into recovery, that's probably the I don't know, that's the zone that's where there's maybe a little bit of a gap, and that's what we were talking about, how to close. And so it's not necessarily about that has to sit, one place or the other. Counties do it successfully both ways. But what we talked about is how do we work a little bit more closely so that the incident management team isn't all of a sudden tasked with managing recovery, which has happened in the past, and or vice versa, that as the incident management team is shutting down, how do we have a smooth transition to recovery and ongoing support as necessary through our emergency manager? And I think that's the gap we've struggled with. Is that fair?
It is fair, yeah.
Yeah.
Okay, thank you, that was clear.
So the next thing I want to bring up are some items that are not on the slide, but they kind of dovetail into some of the interesting programs that we're looking at doing for 2024. The first of which is we've spent the last 4 months or so, about 3-4 months, testing out a Starlink unit on one of our patrol cars, and it has been wildly successful. It provides full, very fast uplink and downlink connectivity to the deputy that's driving that car or other deputies around in every area of the county. So from the top of Independence Pass to McClure Pass to up Castle and Maroon Creek roads, the ability to make phone calls, have connectivity, get back to our dispatch center through the technology that you may remember we've implemented over the last 12 months. The board last year approved the implementation and funding for body cameras, car cameras, computers in the cars, electronic citations, and other different technological systems that all require connectivity. So what we're planning on doing, proposing for 2024 is the addition of 4 additional Starlink units for a total cost of $20,000. It's $2,500 each per unit to purchase, and then about $9,000 annually to run in the subscription costs. That cost is actually offset a little bit by the removal of what we have now in the car, in the computers, which is the Verizon cellular card that provides connectivity within the cell network, which we all know is about a mile to 2 miles off of Highway 82, depending on where you are. So there'll be a little bit of an offset in that connection fee, but I just want the board to be aware that we will be kind of moving in the direction of this technology, which is kind of game-changing for us as a public safety entity to maintain connectivity and that connection back to the Pickens County Regional Emergency Dispatch Center and others. It's also interesting that we can provide it as a hotspot in the event of a critical incident for, say, an area like Independence Pass. If someone's looking to get back and let their loved one that they're on their way or they're safe or they're okay, we can actually provide this as a public access hotspot from the car directly to the community. So,
I can't tell you how happy I am to hear that. I've been trying to push Starlink for quite a while.
I'm happy to hear
great.
that. Thank you.
What line item does that show up in?
That should be under, I don't know where it is actually.
I think that would be other services.
Okay.
It would also give us that technology step up if we lose all our cell towers for one reason or another. We'd still have connectivity, and we can still run our operations smoothly.
Correct. And the other innovative operational aspect that we're anticipating to implement next year is the addition of a motorcycle to our fleet, and you'll hear the request from that for the fleet, the motorcycle specifically from Matt. But I wanted to bring it up here because it is different. We've never had, to my knowledge, had a motorcycle on our fleet in the Pickens County Sheriff's Office. And what we really took a look at is how can we come at some of the highway safety issues that we're seeing now, from speed enforcement, reckless driving, traffic management, and response to incidents, specifically in areas like Independence Pass, where you only have one lane in each direction. How can we develop a plan that allows us to respond to that and to creatively address traffic management and traffic enforcement and education? We don't anticipate that it's going to change any of the ways that we currently do our traffic education. We don't anticipate that it's going to make us more enforcement heavy or anything. It's just going to give us another opportunity and another way to specifically address the traffic needs. And Parker, do you want to talk about that a little bit?
Yeah, the past with the I-70 issues that have occurred in the canyon, when we have the blockages and the narrows in the past, trying to get something that can get through that to take care of all those on their side. A vehicle just isn't something that fits through that narrow gap. A motorcycle would allow us to at least provide that service, but also as we see a growing number of complaints on the highway, having a dedicated traffic resource, which a motorcycle does provide because it has quicker acceleration, it can get those cars that are going way too fast for that highway, much easier than trying to get a Tahoe up to those same speeds where they can actually do that traffic enforcement and that education piece. So it's a multifaceted tool. It'll work when we can't get access to some areas, it shrinks, but also it allows us the speed and maneuverability to catch up to the areas where we know we have problems on a busy highway. So it's going to be a great improvement to where we are now.
Yeah, go ahead.
Are there additional uniform and training costs beyond the 33?
So $37,000 for the motorcycle, and the first year we anticipate, based on the uniform and the safety equipment, about $4,700, which was added to our uniform and PPE line. I believe the training is actually put on by Front Range Agency, and I believe that training is actually free. So no training, and this would be most likely one person this year. In the time span is depending on weather, May to October. We could still implement it right now, and then ongoing with just the replacement of the uniform and equipment costs would be just normal schedule.
So is this like a patrol that be on the highway all the time, or just when they're called out, or?
They'd be, so it would be a regular patrol. So if they're part of a 3-person shift, that one person who is trained to operate the motorcycle and do that type of operation would simply, instead of being in their patrol car, would just go to the county shop and get the motorcycle and use it for their patrol shift.
And be out and about.
Out and about, yeah.
And still responding to other calls when necessary.
For sure. Right. It's not a dedicated traffic unit. It's
right.
It would respond to other calls. And could be also handy, to access areas on the side country for a motorcycle, where a Tahoe might not be appropriate to go up Pearl Pass Road, or some of those roads could actually be a benefit to respond to incidents there.
I have to admit, I had my doubts at first, but once I read about the explanation for it, I was like, oh yeah, that makes sense.
Thank you. I think that's the end of.
I support all efforts for speed reduction on Highway 82.
We do as well.
They had you at that. Huh?
We do as well.
I have a plan. It's not even an infant; it's an embryo. But I have some buy-in from some pretty high stakeholders, and yeah, I'm kind of excited. I'm just not ready to introduce it completely right now.
Now, your increased presence has been noticed for sure by many who've commented to me.
Good.
So thank you.
That's good.
Okay, the next slide shows the 3-year comparison with the sheriff's office budget. On the salary side, thank you. This shows the 3-year comparison in the sheriff's office. On the personnel side, on the salaries, remember that we did add a mid-year position in 2023 that wasn't in the original budget for an additional school resource officer.
Correct.
Any questions on the sheriff's budget before we move on to detentions?
1 second. Not for me.
Okay.
So for detentions, Dan Fellon's our interim jail division chief, and he's at a training in Massachusetts where it looks fairly overcast, actually, based on the picture. Dan, would you like to summarize your budget profile and your kind of, to use John's term, your big rocks for 2024, or do you want me to try?
I can try if you guys can hear me all right.
We can hear you just right, just perfect.
So the increase for Foresight Labs, that is a monitoring and tracking tool for all persons coming into the jail. We're going to roll it out to patrol as well as within the jail itself. So anybody that's getting arrested is going to be having a device basically kind of like a Fitbit put onto their person to track their blood oxygen content, their heart rate, their all their vital signs to make sure that they're not having any issues prior to coming to jail. And then once they're in jail, we're going to be tracking them to make sure that they're not having any issues within the jail itself, whether it's detox or mental health, any kind of crisis like that.
It's actually
The maintenance.
Hey Dan, I'm going to
Sorry.
just build
Go
on
ahead.
that for a second. It's a really interesting tool that we were presented. It like Dan said, right now it's sort of like a watch. They're getting smaller. So that from the moment that an individual gets put into custody by the patrol deputies in the field, it goes on along with the handcuffs, and it tracks their biometrics. And it allows us to ensure that an individual being transported in the back of our vehicle is doing okay, from that their breathing rate is okay, that their heart rate is okay, that we're not experiencing any type of sudden custody or excited delirium situations where they might go into cardiac arrest or anything like that. And then there's a handoff into the facility that, while they're in the jail facility, is really a risk reduction tool that allows the detention deputies on a screen to have through different means, but mainly color, to see whether they're green, orange, or red, to determine whether someone might be either trying to harm themselves or going into some sort of medical emergency. It's being used in a few other counties in Colorado currently, and it's a really interesting and innovative tool that Dan brought to us.
And who receives the information when this person's in the patrol car?
So the arresting officer can have it on their computer in their car, or they can simply have an alert sent to their phone if the individual goes into some type of situation that would be critical.
Cool.
Yeah.
It is cool.
Sorry, Dan.
And the next on our list, no, you're good. Next on our list is the maintenance and replacement of the blocks and facilities. Our jail has been shuttered, closed for approximately 2 years, and so a lot of the maintenance issues that we had, that we were trying to keep up on, have taken the back of inmates back in the facility. We need to replace about 11 or 12 locks that are used most frequently, and that's a one-time expense of around $45,000. The rest is just quarterly maintenance to ensure that everything's working correctly and that we don't have any issues. No one gets locked out of a cell or out of an area that we need to get to. Our nursing contract, we also increased that to 10 hours a day from 8. This allows us to have an AM and PM med pass for people that have medications both in the morning and the night. And that was $77,000 over our current 8 hours a day. And then meals, we have to feed our detainees every day. So we budgeted to provide meals to the hospital as well.
And a number of these increases were reductions 2 years ago when we ended up contracting with Garfield County. So it's just we're reintroducing,
Right.
or re-upping these budget numbers, budget lines.
Is our nursing contract able to meet the expanded service?
Yes, it is. They are doing 10-hour shifts currently, and they will continue to do so.
Well, can this nursing staff assist with our detox requirements for medical detox? If we have one anyway, John? No?
For a couple of reasons. One, most of the people that we're serving in detox are non-custodial, and so we don't want to mix those populations.
Mm-hmm.
And there's a different licensing requirement that needs to be overseen, I believe, by a medical doctor.
Okay.
And that's part of the reason the costs are so high. I will say that we're going to be looking at different detox models and partnerships to try and address the new requirements of the state.
What do you mean? What kind of partnerships?
Currently, Mine Springs is partnering in Garfield County. They had approached the sheriff and then submitted a request to us for funding. We politely suggested we may need to be part of some more conversations, and so I think we're getting invited to that table now. Yeah.
Okay, thanks.
Francie?
Yes, Steve. Sorry.
I am curious about the current population at the jail, and what is our total bed capacity? What do we do if we run over that number, or do we have an agreement with any other counties for transporting extra detainees to their county jails?
Dan, do you want to take that one?
Do you want me to take that? Okay. So currently we have been sitting anywhere from 8 to 14. The last 2 days we've been at our maximum capacity, which is 14 people, which is 14 beds. I have a good relationship with our DA and our courts. And so if we have somebody and we're getting near that capacity, I'll try to see if there's any way we can assist in getting somebody out of custody. We also have implemented arrest restrictions, which have been in effect since we reopened the jail, which definitely helps lower our numbers. There's a lot of people that get, so to say, turned away prior to even getting to the jail. So we're doing everything we can to reduce our numbers, but we do not have any agreements with other agencies to hold anybody else at this time.
And I think it's important to recognize that although we have the arrest restrictions and we have limitations from a capacity standpoint, individuals that belong in jail because of the crimes that they committed that truly pose a safety risk to the public will be brought to the jail. There's always an exception if an agency or an arresting officer feels that there's a reason for this individual to be lodged in the facility, whether it's short term or until they see the judge the next morning or whatever it might be. That we're not turning people away that should be in jail. It's the low-level offenders, the individuals that can easily be summoned into court, are the ones that we're not bringing to lodge in the facility.
I would think that would be quite a relief to some of those low-level offenders. Go home and come back later. Yeah.
I do think it would be helpful maybe the next time the CJCC presents, perhaps we have some updated crime stats.
Sure, that'd be great. We can do that.
Okay.
And this is the 3-year expenditure comparison for detentions. You notice some bigger shifts, as Alex was saying, moving back to more what the budget was a few years ago, with the services being provided in-house, the meals and the nursing services, medical services, and so on. And then you see the larger decrease in the other expenditures line at the very bottom, which is the payment to other governments. And that's where we were paying out to have inmates housed elsewhere. Any questions on the detentions budget?
So overall, having our detainees go to Garfield or Eagle was way more expensive than having them at home?
It's tough to answer because I think there's all sorts of variables in a year that, depending on the detainee, depending on the level of incarceration that they require, their classification, medical needs, et cetera. I think overall it seems to have been cheaper, but the situation could have been different. It just depends on who we have in the facility.
Okay. Okay.
The other thing I'd note that you're not seeing here, but we'll see in capital, are the broader impacts of the public safety facility, the jail facility project, both design and engineering in this year.
They're not in this?
They're not in what you're seeing right now. They'll be in the capital budget.
So let me try to understand this narrative a little bit better. So in 2022, the $3 million budget we're seeing here was to keep a jail open that held people for 24 to 48 hours.
Correct.
Okay. And then in 2024, we're looking at a budget that's holding up to 14, I think Dan said, inmates for however long they need to be housed in the facility.
Correct.
So sort of like
Correct.
the minimal operating to just like have a jail open is 3 million. And
This
okay.
current jail.
Yeah.
Correct.
Yeah.
Yeah, to have our jail. Okay, that's really helpful for me to understand. It seems like we're providing a better service for
in our facility.
Yeah, well, and for our residents, for Pickens County families, Pickens County inmates, at just a proportion of increased cost to do so.
And that was one of my goals, was to get our inmates back as soon as we were able to.
Yeah,
Correct.
thank you.
Okay, if there are no other questions, we'll move on to the coroner's department.
I know we took a while
Thank you,
there.
guys.
Kind of like moving along.
Thank you.
Always great
Thank
to
you.
see you
I'm
guys.
just curious,
You as well.
corners,
Okay, go ahead and take it away.
Hi.
Hi.
I feel like
Hi.
mine's going to be short and sweet compared to that. I like to follow them.
So this is Audra Keith, our Picken County Chief Deputy Coroner.
Okay. Welcome.
So do you want to talk about the org chart?
Sure. So we included the organizational chart for this year, which unfortunately has some updates already.
Oh,
Thank you. Of course, Steve and I are still in our position. Roya is still in hers. Matt is who we promoted after asking for a full-time position from you guys. And John's last day with us is in a couple days. He took a full-time position with Aspen Police Department that's going to require additional training and things, so he doesn't have as much free time as he did before. And Rob's always been in a very part-time capacity. He's the Garfield County coroner. And Kevin recently has taken a position with the sheriff's office, filling one of those full-time positions, so we're not sure what capacity we're still going to have him in either. So we've lost a couple deputy coroners, but with the addition of Matt, I'm still able to share the on-call time, which is great since you guys gave us that position.
and are you planning to replace those other?
Yeah, we always have people that are interested or inquire about a position with us. It's just such a unique position. Our requirement is that you're on call 3 days a month, which seems like a tiny requirement, but people also have full-time jobs in addition to being able to help us out. And so we're asking them to give up, maybe a weekend of their month when they're already working a lot. And so it's kind of hard to find the unique personality that will do the job and the skills that are required with the free time.
Mm-hmm.
So we'll open it and see if we can fill hopefully a couple. It's easier to train two at once, so hopefully we'll be able to fill a couple positions.
So if somebody dies and they have to go, when somebody dies and they have to go, how often does that occur? How often are these people called to duty when they're on duty?
So using John as an example, only because I just recently looked at his reports with him leaving, over the course of the last year, he's filled in like an average of 3 days a month is what he's covered, and he's had 4 cases. But with those cases, they could be anywhere from, an hour if it's a hospice case that we're handling over the phone to 30 hours if you're responding to a scene and going to an autopsy and doing follow-up, and over the course of several days it can add up to a lot of hours, but not a lot of cases really when you're just covering a few days a month. So we listed just a few accomplishments. They were all training and education related. 2 of our staff members became certified through Colorado Coroners Association. In the past, that's really, other than your medical legal death investigator training, which is required for the position as far as education, that certification is the only one we've really pushed in the past that everyone obtain. And so we were able to accomplish that. And then we had individual training for different investigators for fingerprint comparison, dental morphology, high altitude body recovery analysis, and representation at quite a few different conferences and organizations throughout the last year. And then our first American Board of Medical Legal Death Investigator Diplomate certification was obtained this year as well.
What are the minimum qualifications to be a coroner?
To be the coroner is different than a deputy coroner.
Sure. A deputy coroner.
Yeah, it would, really just the medical legal death investigator training is the biggest requirement. And then these different certifications require continuing education.
Mm-hmm.
And so that, later after you become a deputy coroner, then those would contribute to your education throughout your career with us.
Is there any possible alignment with CMC on training?
Possibly. Medical legal death investigator training is only 40 hours.
Mm-hmm.
For that certification, then a lot of on-the-job training, which for us has averaged 3 to 6 months, depending on the person's experience. And, if they've worked in public safety before, which is where we get a lot of our interest, it cuts down the training significantly.
Mm-hmm.
But possibly, it would maybe be worth talking to CMC about, because they do offer, both health and law enforcement training and classes there. So
Yeah.
is
Okay.
possible.
Thank you.
Sure. I think we maybe talked about these last year just a tiny bit, but one of our larger requests is for a BioSil body bag system, and essentially it's like a roll of plastic in a case that you can take to the scene or use in the morgue, and you're able to seal things, whether it's disease or decomp, and get rid of the odor and the risk. And Garfield County's been using it a long time. A lot of coroner's offices do use that kind of system, and you only utilize it, when you need it. We wouldn't use it with every body bag. But it's nice for funeral homes as well because they can cremate in the bag. It's biodegradable, and they're able to use it in that capacity as well without having to open it back up. So that cost is for 50 bags, and they have a life to them, and so there would be an ongoing cost. I don't have that with me. I think it's like every 3 years we would have to replace the roll of plastic, and it's a portion of that because that's the whole sealing system. And then naloxone is more commonly known by the brand name of Narcan. First responders carry it in a lot of places. Coroners carry it in other places. We're just requesting the $300 to give each one of our coroners one to carry in their bag so that we have it with us on scenes. Unfortunately, in Pickens County, we come into contact with things like fentanyl, and just to have that resource there in case any symptoms of overdose are noticed with any of the first responders on scene or family.
So why would the coroner need it? I'm assuming the coroner goes when the person's already dead.
That is true, but we come into contact with whatever killed them. So if we go to a scene where fentanyl's on the scene, then potentially we could come into contact with it, or officers or family members who are on the scene could start getting symptoms from it.
I see.
Yeah.
Thank you.
Sure.
What a shit state of affairs, huh?
Yeah. And then fire boots, that cost was $2,400 to, which would be a little less now because of staffing, but the fire boots are so that we can go into scenes. Unfortunately, our call in 2022, where we lost a couple people, we had to wait for the scene to cool down enough. Even if the fire's gone, it stays at an elevated degree of temperature for a very long time. And on that scene, we actually, Matt and I responded on that scene, and we borrowed boots from people. I used the private insurance agency's boots, and Matt used the fire department's boots. But, we were also, for me, I was walking around in boots that were 2 sizes too big out there on the scene. So Marshall Fire is another good example. Their coroner, a lesson that they learned was that they needed the boots because they had to wait to go into scenes too because it was too hot. And so I included that with kind of a long-term goal of preparing us more for those kind of things that we don't run into often but may need. We've responded to plane crashes and things where they would have been a benefit for both the heat and safety of, the sharp metal and things like that that are on scene that we walk through. And then education and training is kind of a significant increase that I was asking for with having more people certified. That requires more continuing education. And we were just trying to have more of a involvement in some of the organizations that are coroner and death investigation related, just to build our contacts out and get that education.
Okay, so this is the proposed 2024 budget for the coroner's office. Remember that we did add a position mid-year in 2023. That's why you see that jump there in the personnel line.
Okay, so if we had seen, if we saw the 2023 actual budget, it would be
It wouldn't
in the
be
middle.
such a big increase.
Yeah,
Right.
okay, got that.
Any questions?
No, I'm always are you working on any unsolved cases? I know you had some in the past.
So Brad Gibson and I work occasionally on a 2012 case. That's the only unidentified case that we have. We explored the option of exhuming the body and got some help through, he used to be a Boulder County investigator, Steve Ainsworth. He kind of helped us a little with what he thought, moving forward, because he's had quite a few. But most recently, we kind of put a halt in that to explore more with fingerprints. There were partial prints pulled then that didn't get a hit on anything, but there's databases that coroners can access that law enforcement can't necessarily access to try to match those. So that's kind of the avenue we're exploring right now, is to try to match him that way.
Interesting.
So, it would be nice if we didn't have to dig.
Yeah.
So we're working on that.
Thank you.
Yeah.
Okay.
Okay, thanks so much.
Steve,
Thank
any
you.
questions? Thanks, Audra.
Hi.
Okay, next we have Brett Loeb and dispatch.
Welcome.
Hi, Kelly, Francie, Steve.
Good to see you.
Good to see you guys. Just this last year, our comm board voted to move dispatch itself out from under the sheriff's office, and the natural landing point was under county admin. So that's going to take effect January 1st, 24. Normally, I have the sheriff talk for me, and now I've got to do it on my own, so bear with me. So since we're new, at least as a department, I wanted to just, give you guys some stats so you understand what we do and who we are. We take about 100,000 calls in and out of our center every year. About a quarter of those are emergency calls coming through our 911 system. We dispatch for all of the fire and law agencies down to Garfield County, except for Eagle County Sheriff in the Elgin area, the Eagle County portion of the Roaring Fork Valley. And then we also dispatch for Carbondale Fire, who's also dispatched out of Rifle for the Carbondale area. Anything in Pickens County up 133, and including Marble and Gunnison County, we dispatch Carbondale Fire for that. And then we also have a lot of not main user agencies, but agencies that we in some way, shape, or form help or dispatch for, including Mountain Rescue, Forest Service, the airport, open space, parking. We've got quite a few agencies that we also help out with that. All pick-and alerts are launched from our center. We don't craft them if we can help it. Usually the people asking for the alert to be sent, unless it's a standard one that you see all the time, like avalanche mitigation, things like that. We try to have the incident command or whoever's requesting the pick and alert craft those, just because as normally when we need a pick and alert, there's a lot going on, and our dispatchers are pretty busy taking care of the incident, and don't have time to sit there and try to craft an emergency message. We handle warrants. We deal with our CAD system is also tied in with the record systems that all agencies use. So we manage all of that. And we're also the master control for the interior jail doors.
Meaning that you can just shut down all the jail doors?
Well, they're in the state of shutdown naturally, but if the deputies inside need a door opened, they call us on the radio and ask for that door to be opened.
Wow. That's amazing.
Who handles the CDOT sign messages?
CDOT.
Okay.
Yeah. We can
So
request.
is their ability to be nimble?
We can certainly, and we have some, we use our contacts to ask them if there's something needed. And we work with them pretty closely.
And can they change messages pretty quickly?
They can do it really fast. It's through their Hanging Lake Dispatch Center.
Okay.
So we can go direct with them and make that request.
Okay. Good to know. Thank you.
Thanks, Connie. We have 14 FTE emergency dispatchers. We also have a operations manager and a public safety IT manager that we just added last year. I'm happy and knocking on wood to tell you that we are hired up to 14. We still have 4 in training, but we expect them out by winter season, at least 3 of them. And we haven't had a proficient dispatcher leave in 16 months, which is something we haven't seen in a long time. Staffing's always been our largest issue. And now that we've, for the time being anyway, overcome that, it's allowed us to really focus on a lot of the other things that we wanted to do. And that's a huge luxury that we're hoping we'll be able to sustain. We already have partners within the county. We work closely with BIDS. Our dispatchers have always been employees of the county, so none of that's going to change. Benefits, any of the offers that all county employees have, they've already got. So I don't think the dispatchers are going to see hardly any difference at all in the day-to-day operations. I'll probably go to a few different meetings, and that's about it.
And who will supervise you?
We haven't quite landed on that yet. Unless John's got some insight for us.
Yeah, it will.
I guess we approve the org chart every year or something. I don't remember.
We approve a table of organization, but the intent right now is to have Ann Driggers oversee.
Yeah, which we'd be happy about.
Could you translate those acronyms for me?
Oh, sure. Which ones?
PV, that line.
All right, sorry. So PV is the Pro Velocity. That's our third-party IT bin. BITS is the county IT department. Business, business.
So I can jump in on that. We used to stand for Business Information Technology Services. I know there has been some changes recently, but I don't think we've changed much of our branding, so I see the confusion.
Okay.
Sorry if I called you the wrong thing.
All right.
And telecom, obviously, they're
and HR, I know. Okay.
And they run the public safety radio system.
Okay.
4 years ago in October, the BOCC and the sheriff granted us first responder status. We were the first in Colorado to achieve that. Since then, there's been about 25 counties that have elevated their dispatches to that same status. Right now, unfortunately, until it becomes a national level elevation, there's not a whole lot behind that except for a little bit of pride and considering ourselves on par with the people that we work with and support. There is a bill in Congress. Hopefully that will change that, but it's been there for about a year and a half and haven't seen any movement yet.
You got your little pin after COVID, right? Your little.
Yeah, right. We did do that. But that's another thing that we really are proud of, and
it does give some priority in APSHA housing as well.
Yep, that's true. Yeah. So we're hoping for a national level, but a lot of the things that we're doing and coming up to full staff has been our goal for the last 5-6 years. It's taken us a long time to get there, but the way that we've kind of designed it and the way that we're starting to attract people and retain people is really, I don't want to say revolutionary, but it's different than a lot of the country. A lot of our industry is still stuck in the old ways and doing the same thing over and over and getting the same result with poor staffing.
I just think about those murders in Idaho.
Yeah.
If those girls had been able to text to 911.
Right.
Like, oh my God.
Yeah. So we have really been at the forefront, and Joe, before Michael, and Michael as well, had really supported us in going out, trying to find technology that not only helps the citizens, but makes the dispatch job easier because we've learned with all these new systems coming in the job has become so complex and so difficult that number one is driving people out of the industry, and number two, it's very difficult to be successful and to perform to the standards that our agencies and the citizens expect because it's so difficult. We've added video to 911, we've added satellite device to 911, although the cell phone companies are now starting to add that into their technology, so we don't need a separate system for that.
So do you just go to send your video and the address that you send it to is 911?
No, so what happens with the video is we are able to send a link. If they're calling from a cell phone, we're able to send a link to them. When they click on that link, it connects their phone and their camera to our center. So wherever they point their camera, we see.
Wow, really?
Yeah.
So if I have an intruder way over at Stark Mesa and I call you guys, then you'll open up this link and I could like track the person and you'll see it?
Yeah. We haven't used it for that yet. But we have used it a lot of times for smoke reports. Say, hey, show us what you're seeing.
Yeah.
And that helps us, identify where it's close to. We've seen it for people that are lost on the mountain.
No kidding.
Show us your surroundings and we can help you get down or on trails. We've actually caught a few bad guys with it, where there was one person that was in Pueblo, committed a crime here, and we found his cell phone number. He answered his cell phone, and then we sent him the link, and he clicked on the link. And that gave us his exact GPS and actually gave him a video. He was sitting in a Walmart bathroom eating a can of beans.
Wow.
So, that's not something that we use every day, but it's a tool that our dispatchers have that help them do their job.
That's really interesting.
Yeah, and that's a lot of what we're working for. The voice to text, we just put that in this year. We actually found someone that had been working on this technology with the military and air traffic controllers, and it's basically closed captions for the radio. And when I came in 7 years ago, that was the biggest complaint from our fire departments. We've got one dispatcher listening to 2 primary radio channels, and the law is in their ear. Fire comes out of a box in front of them. Oftentimes, the fire and law are going to an event. It's a big event, and they're both talking at the same time. So we hear law, we have to ask fire to repeat. So we finally found this technology that now they not only hear it come out of the speakers or in their ear, it also scrolls, text scrolls in front of them as they talk.
Wow.
And now, having solved that, now we're going to build on that, and now you can take that text, cut and paste it into our call, and send it out to the officers responding, and build on that even further, and start bringing in AI and machine learning, because once you have it in text, then it can operate off of that, and it just becomes a force multiplier where now our dispatchers can take several calls at a time and really just be monitoring as it goes through it.
That is so cool.
Yeah, it's very exciting, and we've put a lot of this stuff in and have worked on it and have really developed a reputation. Our ops manager, Brad Flanagan, has done several national keynote sessions on the technology that we're using and also the culture and philosophy that we're bringing to the centers. And we've had a great response. We actually got our last dispatcher saw Brad at a convention and sought us out and applied for a job, and we brought her over here. So it's starting to pay off in a lot of ways.
Well, Joey used to brag on you guys quite a bit.
Yeah, Joe was
great.
He
was really proud of that.
Yeah, and he was very supportive, and like I say, Michael has been too, and I don't expect any of that to change going to the county.
That's great.
Did I have anything else on there? Oh, no. One more slide. Thanks. So moving forward, the biggest thing that we have going is what we're calling our Public Safety Systems Project. $7.3 million to upgrade our, so those acronyms, computer-aided dispatch, records management system, and jail management system. That's the core technology that all of our agencies use. We want to build out our network infrastructure so it's more robust. So we have connectivity in Highway 133, as well as Frying Pan Valley, up the pass. The sheriff mentioned Starlink. We're working in partnership with them to integrate that into dispatch. And we have a lot going on in the next 5 years, but I hopefully won't be coming to you guys for money to fund any of that because we've worked out and we have a proposal into the state PUC to raise our E911 surcharge funds. And that, if that's granted, which we'll know by the end of this year, that should cover all of the costs for this project.
Is it helpful for us to testify during that hearing?
Maybe. Hopefully
Let
it
us
does.
know.
Hopefully it doesn't come to that.
Okay.
If there's an issue or they call it an intervention.
Otherwise, they just consent.
Yeah.
Okay.
But if we do need to justify it, that could be a possibility. And I would appreciate that.
Yeah.
I think that's it.
All right. This is the,
I've got a question. I know that the lease at some time in the North 40 Fire Station is coming up. It seems to me the ideal place for the dispatch center to be there, but what's your take on, is that location working for you, or would you anticipate moving to a different location potentially?
Well, a couple things with that. Yes, our lease is up February of 26. The Aspen Fire Department has indicated that they would like that space back. It's possible, though, that we could negotiate an extension. One thing that we've learned that actually really came out of COVID is we don't need one main dispatch center. We've actually built out a center in Basalt at the south side building that the county owns, and we have 2 dispatch consoles there. It's a full operational center. We oftentimes have one dispatcher in Southside and one dispatcher at North 40. And we also have 2 consoles at Mountain Rescue. During COVID, we used that as kind of an isolation chamber, but we learned we could function with dispatchers in 2 separate locations without having to build a $15 million center in one place. And these centers actually serve a couple of purposes. One, having it in Basalt rather than up in Aspen, it helps our dispatchers who commute. And then also for just resiliency and redundancy. If something happens at one center, we can just move our people over to the other center and be up and running, which is why in a couple years, our hope is to build a 3rd satellite center in Glenwood Springs. And what that does for us is put us outside of the technology loop that goes from Glenwood all the way to Aspen and back. If we get on the other side of that switch, it allows us to have redundancy and multiple entry points into our system and our network that would really prove to be, right now, if it's on this side of Glenwood, something cuts. We've seen it happen a number of times in the last couple of years. Everything goes out. This gives us some opportunities, but as I say, that's a couple of years down the road.
So if someone dials go ahead, Steve.
Would you still need 7.3 million then over the next 5 years for replacing the failing system, irregardless of what location you're operating out of?
Yeah, we have 3 satellite centers included in that number.
Okay, it sounds like you've got good ideas and you have a good handle on where you need to be and what you need to do.
So if somebody dials 911, does it go to the nearest dispatch, or is it controlled by GPS where you are, where the call goes?
In some ways. So a couple different things happen, and it depends on if you're calling from a cell phone or a landline.
Let's just do cell phones.
Okay, yeah, and that's about 85% of our calls now, so so that's a good thing to look at. What it does, 2 things that happen. One, it hits a tower, a cell phone tower. That tower is programmed to send the calls to whatever area the PSAP's in. So El Jebel, even though it's in Eagle County, the calls that hit that tower or the towers around there will come to our center. Sometimes when you get on the edge of things, it goes to the neighboring center, but we have ways to deal with that. So that's just the general, the old school, the tower that's closest to the center sends the call there. Now there's new technology we've brought in. Again, we were a pilot for this company called Rapid SOS, and they have another clearinghouse that's based off of the GPS location of the cell phone. So that goes to the clearinghouse, comes back to the center through a different technology. So, for example, when our towers are down, we still see the Rapid SOS call come through. And in fact, it's helped us quite a bit, because it is, I mean, you call Domino's, they know exactly where you are. You call anybody, and you know exactly where they are because of all the triangulation and GPS technology in the phone. The reason that they could do that and 911 couldn't for so long was when you sign up for Domino's or Uber, you select a waiver, basically, that says, I'm okay with them using my location. Finally, about 5 years ago, they determined if someone calls 911, they're granting consent for you to have their location. So that allowed this whole technology to come through. And just a quick story, we had a person, domestic kidnapping, that called from Carbondale, got Garfield County dispatch, said she was being held without her, against her will. And then hung up, and they couldn't get her back. They let us know, and everybody started, searching and trying to find it. We did a ping, you call it, where off of the towers they can try to find the cell phone, and that came in with like 3,000 meter radius, which at the time we thought they were in Basalt, and I mean that's the whole town of Basalt.
Yeah.
The victim that was, we're not sure exactly, but she was in the front seat and restrained somehow. She managed to make a 911 call twice. That came because it was from her cell phone. That came to us through the Rapid SOS system, which pinpointed it to 3 meters, and we were able to find her. So all of this technology is, kind of coming together, and we're trying to be prepared for it, and it's already paying off.
That's really cool. I know that when we call from our house, which is really far away from the sheriff's department, it goes to Pickens County. It doesn't go to Carbondale. So, you know, if
Yeah.
I have a really extreme emergency, and I call and I get you guys, what happens?
Yeah.
Do you then call the Carbondale police, or what happens? Because I know we have been responded to by you guys before, and it took a really long time. It wasn't an emergency or anything, but
So was that, so is your house up 133?
yes.
Okay, so yeah, they should come to our comm center. If it's something, because you're outside of Carbondale's police's jurisdiction.
Right.
But if it was something there, we would transfer you over to Garfield County. So those should come to us. Now.
They do.
Yeah. Now, it actually goes to Miami first, if
No
you really want to
way.
know the gory details. So, yeah, the national 911 system, all calls go through Miami, or there's some place in the Midwest as well. But I mean, it's seconds. It's not anything
Right.
that would delay it. But
Wow. That's
fun
interesting.
fact there.
Okay. Well, that was really helpful. Thank you.
I don't think we have anything like really special in the budget.
No, the personnel increase is actually less than our wage increase for the year. Other services includes phone and fiber, so there are some additional costs there. The main increase that you'll see is in this property line. And this is where we'll start to see some of those projects coming through, as Brett mentioned, with all of the technology upgrades. There are a few smaller pieces of that are beginning in 2024. The larger pieces will be 25, 26, and the next few years down the road. Where you see that compensated is in the revenues, especially if the 911 receives the additional surcharge amount, then they will be able to make up for those increased capital costs within the dispatch department.
Okay. All right. Well, thank you.
Yeah,
That
you're
was
welcome.
really interesting.
Thank you, guys.
Thank you. Yeah, glad you have a great crew.
Yeah,
Hanging on.
yeah.
It's
we're
amazing how
excited.
much you do with only 17 employees.
Yes, all day long. Thank you, guys. Have a good
All right,
day.
cheers.
Thank you.
So I'd propose a little break, and then we'll continue on with housing, if
Okay.
the board is okay with that.
Sounds good.
Welcome back to the work session for the Pickens County Board of Commissioners on Tuesday, October 17th. Surprise, surprise, we're still talking about the budget. And now we're going to hear about housing.
Yeah,
Look at all those housing faces.
Good afternoon. We're going to have Rich kick it off with the housing presentation, but as you can see, we've got a number of different staff here and online. Jody's online too, representing different aspects of housing. So Rich, I'll push it over to you.
Hi there, Rich.
Great. Well, hello, commissioners. You guys are doing great. You're on time for your first budget work session. This is awesome. So,
Because there's only 3 of us.
well, that's all right. You're on time. You're doing well. So thank you, Rich Engelhardt, Deputy County Manager. I'm just going to open real quickly with a couple of comments and then kicking it over to Kara. But as you know, we always kind of look at our strategic plan and how the housing aspect fits into that, as well as the goal of the Board of County Commissioners. Whenever you line up our core focus areas and they touch these others of the prosperous community and the flourishing and natural built environment, our livable and supportive community component really does, when we work in tandem with each other, creates a healthy community and a safe community. And certainly we're offering to do the best we can to try to promote that high quality of life. And I believe by your commitment as a board, which you're going to see substantial dollars, as you already know, towards housing, really does deal with that quality of life. And certainly safe, affordable housing's a big component of that. So as far as our overview goes, we do have really kind of 3 main goals, but this last year there was a shift in the impact fees, using the housing impact fees because of how they were limited in our ability to really expand on our housing ability. But we really look at conservation, which is maintaining our existing units, conversion, which is converting existing free market into the deed restricted programs for employees and the community, and then construction and codes. And we're going to hit on those in more detail. And again, we've got staff here to be able to answer any questions you may have. But as you know, we did a restructure almost 2 years ago, and this year we have started to implement and putting people in the right spots. However, I think when I kick this to Kara, you're going to see our org chart's a little different. It kind of looks like a football huddle rather than lines going out to certain aspects or certain people, because of the fact that it really is a team effort. And we're still working through the organizational side of this. And with resiliency coming on, it looks like housing may fit into that mold a little bit more. But just know that we do have a number of staff. You can see here, there's 2.5 full-time dedicated towards this now. One of those is a position that the board has approved that's yet to be filled, that we have been having conversations about to make sure that we certainly put those efforts in the right spot. So, but with that, we do have a team here for you to answer any questions, and I'm going to kick it over to Kara so she can show our huddle.
You're into football right now. I can see that.
I guess I am. Yeah, thanks.
Thought it was going to be a baseball diamond, Rich.
Close.
He can't help himself. It's
I
football
know,
season.
he can't.
I mean, you know.
No, it's
Yeah, no,
baseball playoffs.
it's the World
Come on.
Series, but
Yeah.
really, we don't have baseball so much.
Well, thank you, Rich. So, Kara Silbernagle, Deputy County Manager, and then we've got Ashley and GR both here as well, but you'll see some other names up here. And as we started going through the org chart, really, you know, we are at the county with the board's direction, really starting to give some more dedicated resources to Pickens County housing, but it still is a little bit, you know, everyone's dabbling in different areas. We've got human services on here. I'm remiss that I missed adding community development, which obviously takes in the housing impact fees. So there's add one more square to the box. And so really this next year is to take action on housing, as well as really making sure that we're resourcing it correctly to make sure we can deliver on the board's goals. So with that, we're going to kind of walk through how we're working on the housing funds. So as Rich mentioned, the Housing Impact Fee Fund, I believe it was last year or 2 years ago, we really moved this to really be the Workforce Housing Fund, just to keep it clean as far as the fees that are being collected and the stipulations with those fees, and then the expenses related to it. So right now, that really is primarily Phillips Mobile Home Park. The BOCC housing allocation, which we'll get into, is also in there, as well as then the free market buy downs that we do for rental units is also captured within that fund. Then, based on kind of where we've grown some of the housing efforts with the board's direction just a couple of weeks ago, the capital fund now houses the Picken County Deed Restricted Purchase Program. So this is where all the acquisitions and potential buybacks will now be sitting directly in that fund rather than in the Housing Impact Fund. And then within the general fund, with the creation of the resiliency position, as well as the assets and housing, we really moved a lot more of housing resources into the general fund to give that flexibility to work across the entire continuum of housing that the board has requested and wanted to be in. So that's Ashley oversees the housing strategy and planning effort, and then the housing operations, which is the maintenance and operations, is what Jody oversees. So Ashley's gonna help me out in this one, in this math. So what this is based on the board direction a couple of weeks ago. So we just kind of wanted to walk through what is the BOCC housing allocation. So this was $5 million is what the board directed in 2023. And then with the general fund paying back the housing fund for the deed restrictions, there's an additional $2 million and some change added into that. The board throughout the year has directed and already awarded, I believe, or distributed the $200,000 to APSHA for the capital grants program. And then based on the discussion a couple of weeks ago, there is $1.2 million that will be coming out of roughly the $7 million to support the ARPA funding strategy that the board directed, that so complementing it. So that is the buy down program, the rental assistance program, and the other ones.
The transfer to West Mountain Regional Health Alliance for housing navigators, and the emergency transitional housing or emergency housing that we talked about 2 weeks ago when we laid out 5 different housing opportunities for ways the board could support housing through the use of ARPA funds. Those are all included in there.
That's the Housing Coalition contribution that we talked about coming out of ARPA?
We did not talk about that coming out of ARPA.
I thought we did.
$20,000.
Yeah, the membership $20,000 is actually coming out of strategies and programs. The $2 million for the buy down is coming out of ARPA.
Yeah.
So, and the purpose of this slide, and you'll see where this all kind of plays out, but the purpose of this is just really to see that moving forward in 2024 with all these different changes, there's essentially $5.6 million appropriated in the housing fund that is kind of that BOCC housing allocation.
I don't see how you get that number out of these, but I'm okay with your not explaining it. Just keep going.
Connie?
It looks like a good investment. We put in 5 million, now it's up to 5.6 million. But we need to be spending that 5.6 million not to affect the housing program.
Yeah, this page doesn't really work for me, but no worries.
Yeah, I think we wanted to just make sure the board knew when you see in the housing fund 5.6 million appropriated, and the board had talked about 5 million and then talked about 7 million.
Right.
And so why is it 5.6 if you talked about 5 million and 7 million? Well, we're using some of it within the general fund is why.
Okay.
So instead of 7 million, part of it's being used in the general fund instead.
I absolutely believe you.
Okay.
Took us a while to get there too. So within the housing fund, this is mostly handing it over to GR, but this is really a lot of the work related to the Phillips Mobile Home Park, and then the 5.6 million allocation for opportunities that come up, whether it be additional infrastructure or traction on Phillips Mobile Home, other buy downs that come up, or other opportunities and partnerships that I know Ashley is working on as well. So, GR, anything you want to touch on?
Yes, I'm GR Fielding, the Engineering and Construction Director, and I'm serving as the project manager now for Phillips Affordable Housing Project.
You want some more jobs to go on top of that, GR?
I just wanted to say that out of all of the projects that I've run for the county, this one, each bullet point has been as hard fought as I've had for anything. Nothing's coming easy, and so we are really looking forward to bringing forward all of these different items for the board to consider for Phillips. The $900,000 for the design, and that will be allocated for this budget, obviously doesn't get us anywhere in construction, and will be coming forward once we get through our schematic design to get whatever additional funding we need for final design and to begin construction process.
Where is that 900,000 coming from? Because it still leaves 5.6 at the bottom of the page.
The 900,000 comes from the housing impact fees, and some of that is being rebudgeted, and I don't remember exactly how the math worked out. But that, again, we recognize that that's not going to get us too far into the development process, but right now that's what we can easily predict to get us through with the wastewater treatment facility, the water treatment, the water storage, and all of those various pieces to that project.
And when you put those forward, those projects, is that dependent on a certain number of units? The design of that and the cost of that, is that dependent on a certain number of units?
It is. We've been moving forward with the 73 units that the board had directed through our conceptual design. Each bullet point there is modular in a different way. For water, we would need to upsize, say, a storage tank or downsize it depending on the number of units that we ultimately end up with. Wastewater treatment facility is similar. Each one of those bullet items has a smaller or bigger kind of margin of what we design around for parameters. So if at a future work session we had a different number, we can react to that.
Well, I think you will have a different number. I know you're so happy to hear that.
Do we have so is just 2024, is it just expected for the timeline that only the design and water infrastructure elements, that's all that's going to happen in 2024, or?
I think we will be able to make some significant strides into design through the early part of 2024. How much things change will obviously dictate some of that overall schedule. Also, as I said, every bullet point has been very hard fought. Just to figure out how much water we can get out of the wells took months and months of coordination and finding the right equipment and the right people and getting everything to line up, finding all of the leaks in the existing system before we hooked up a temporary tank. The wastewater treatment facility, to get a planning target from the state has been, 4 or 5 months before we could even contemplate how we would do final design and knowing all the pieces of equipment that goes into that. So to answer the question again about timeline, 2024 we'll be able to get up to and through hopefully final design, but I also thought we would be further along, but everything has been hard fought.
But not horizontal work, not yet in 2024.
I would love to be able to say that I'd be here for a Q3 supplemental to get started on horizontal work. It sounds like we have some big questions to answer, but hey, it's okay. I'm gonna manage the project no matter what the board decides it's gonna look like. So, but it depends on how fast we can turn around with some of those sorts of questions.
Okay.
Okay, this is the Housing Impact Fee Fund.
I see a blue star.
The Housing Impact Fee Fund, the main revenue source are the impact fees. It's collecting the fees and then using those fees for the allowed purposes. Starting in 2021, we've had a few years where there's been a lot of fees collected. It mirrors the activity going on in ComDev and I think in our community in general as far as real estate goes. So you see 2.6 million in 2022, almost 2.8 million in 2023. The 2024 budget is conservative at 1 million. It's very unpredictable. It can vary a lot just depending on what types of applications and permits are going through. So that's the main revenue source. On the expenditure side, we've got the 500 and 400,000 together are the amounts for Phillips. We have the 5.6 million that we mentioned before, which is the board's allocation, whether it is used towards Phillips and the final design and planning in Phillips or used towards other housing capital projects that are in line with the housing impact fee. That's at the board's discretion. The money is appropriated there and available for the board's use. You also see the transfer from the general fund. This is net of the programs that will be paid out of the general fund. So that's where we get back to that other slide that was a little confusing. The general fund had planned to transfer 5 million, but then we added another 2 million. There you get your 7 million. However, some of that will be spent in the general fund. So we're subtracting out the portions to be spent in the general fund, and then the remainder is being transferred into the housing fund. At the end of the day, you have an ending fund balance at the end of 2024. If that full 5.6 million was spent, you have an ending balance of $2.9 million. So when you're looking at Phillips development or any other housing project that fits within the housing impact fees, you can use the 5.6 million, but then there's also some fund balance that could be appropriated also, should that be necessary.
Okay.
Questions on the housing impact fee?
This is definitely the squirreliest one for me. It's like I go through the others and all the numbers look just right. I get to this one and I'm like, oh. Okay, I'm okay with it, Connie, because you're okay with it. How about you?
Yeah, I hope the year-end 2024 has like a bunch of additional money in it.
And also has a balance
Perhaps
of like
from intergovernmental transfers or something.
Yeah, and a balance of 100,000 by the time we're done. We've used it.
Where's the line item in the general fund that the other two?
We'll see that coming up when we look at the Housing Planning and Strategy Department. You'll see 2.55 million there.
Okay, thank you.
Steve, any questions?
No questions. It is confusing math, to say the least.
Yeah.
Francie and I are both former math teachers, so we should understand this very well. But I'm glad we have Connie on board to keep track of all the pennies.
Me too.
I think it'll make more sense when we go through the next portion. Yeah.
Okay. So, all right so far.
So to the capital fund, and I trust me, it's confusing. It took us all a bit of a time to wrap our heads around, but I think really thinking the housing fund is really that workforce housing to meet the requirements of the housing impact fee. And then a lot of the other efforts in housing is where you're going to see it in the capital and in the general fund.
I guess I don't understand why it's not all workforce housing. Isn't it all workforce housing?
No. So when we're thinking about, for example, some of our transitional housing, like what we did for response, some of our emergency housing for homeless, those sorts of things.
Okay.
Yeah.
Okay, I'll get that.
And some of what we're doing for our own employees, which would be the employee deed restricted program, because it's somewhat housing, but also a recruitment and retention, as we discussed with the board. So this is new, but we will now have within the capital fund a line item for housing, I believe, Connie, which right now is specific for that employee deed restricted program. So that is where the 2 million transfer from the general fund to pay back the housing fund for the acquisition of those 8 or 9 units that are right there right now. As well as then it includes 800,000 for 2024 for additional employees that would like to enter the program, and 1.2 million for possible buyback of those assets. In future years, we anticipate that future transactions will cover the cost of buybacks. So, for example,
The cost of what?
Will cover the cost of buybacks. So, if an employee chooses to leave, right, maybe we determine it's a great rental unit that we want to option, then maybe the housing fund can purchase that program and pay back this fund. So we anticipate those buybacks will cover their own costs in future years.
Could you just, in a couple of sentences, so we have the equity sharing program, that's an acquisition, and then so what is buyback?
So this is if an employee, right now, right, that housing unit is tied to the individual's employment with the county. If the person chooses to leave the county or just, sell the unit for whatever reason, the county exercises its first right of refusal.
But that's on a house that's been in the acquisition program.
Right.
Okay.
Yes. Yeah.
And Francie, I can offer up a little bit. I mean, the success of that program, we've had at least 18 employees over the time access that. Currently, we have 11 that are active. During that point in time, there's been $10 million invested in the private side with those employees, of which we've contributed right around 40%. So since 2017, when we started this program, we've invested almost $4 million into that, and we've picked up 6 of those units after an employee has left, and we've been renting those out, or else we have the one on Cooper that we use as an employee touchdown space. So it's been successful in helping with our recruitment, and I really believe the goal that you guys have changed now with this 5-year plan is going to help with our retention side of things. We just had a couple that we just closed on. In fact, one we closed on yesterday. So employees are starting to take a look at this. So I'm hoping that on the retention side that those changes are going to help. So it has been successful. This program's been kind of in the kind of back side of all of this is what's transactioning. And in fact, today we just an offer or a unit came available. We're going to make an offer on it that these funds will help purchase. It's a single room unit in a great location. So by having these allocated, it gives us the flexibility to move on those quickly. And then we come to the board, and we'll give you the details of those, and you all ultimately have a decision whether you want to buy it or not. But we tend to act pretty quick on picking up some of these units. So we are investing in the community on the free market side, and it's been working well.
That's great. Back to whom?
Okay. So then in addition to the capital fund, there are 2 line items in the general fund. One is housing operations, which I can hand it over to Jody, and that really is about the maintenance and operations of our existing units. So Jody, do you want to walk them through this?
Sure. Jody Smith, the Director of Employee Housing. We are currently own and maintain 22 units for the general fund throughout the valley. Some are in Aspen and Basalt. We don't have any in Carbondale at this point, which is great that we're keeping our employees in the Mid-Valley and up. It's been really, again, very successful. It's helping with our retention, and it's also helping with the hiring of bringing people in, and we're balancing that out as we go. And then we also have the operations of the Phillips Mobile Home Park, in that we have a ranch manager who does property management, and then and then we oversee bigger picture on that, and the operational costs. Yeah, and then our contribution to APSHA each year as that changes. And I'm happy to answer any questions.
So in your first thing there where it says maintain and sustain existing housing units, 22 total, including Phillips, shouldn't it be plus Phillips?
Or excluding.
Yeah.
Yeah.
Yeah,
Plus,
it doesn't make any
yeah.
sense the way it is, because they're like 38 or 40 at Phillips,
Yeah,
right? Okay.
it should be outside of
Making sure I
Phillips.
wasn't totally off the mark here. Okay.
That is correct.
Okay.
Okay.
So within the general fund, we have housing operations. So that's Jody's area of maintaining the upkeep on all of our owned units. And you see before you the 2024 proposed budget for that department. On the staffing side, mid-year 2023, there was the addition of a housing specialist position. The one that Rich mentioned has not been filled yet. That's why you see the bigger increase on the personnel line. In other areas, really not a lot of difference, even where you see 171% increase, the dollar amounts are really very small there. The largest increase is in that other expenditures line, the last one on this chart, and that is our payment to APSHA. So that's where you see that APSHA increase coming in. It's through this budget area.
And didn't we authorize a new truck? Where would that be?
That would be in the capital fund.
Okay.
Any questions on this budget area?
Now, just about Jody. So, Jody, your job now, your title now is what? It's like employee housing?
Asset and employee housing. So we're taking care of the assets, so capital projects and bigger picture on the buildings and properties, and then the housing units. And this is where I'm going in and I do inspections of the properties before making a recommendation to purchase one. Like this morning, I looked at a unit, reached out to Rich and Kara and Ashley about making an offer, and then following that through. I'm also assisting. I met somebody this morning with the EHOC, the down payment assistance program. I met with an employee this morning to help them get started and kicking off. They're getting up to $50,000 of a loan, which is part of your generosity. So I'm really kind of there representing and getting employees and units ready and available. And then I do all the leasing for the commercial, nonprofits, and the tenants.
Okay, great. Thank you.
Okay, and then the fourth tier, I guess, in no particular order, is then the housing strategy and planning. And really, this came about with the creation of the resiliency position, and really dedicating half of that position to housing and more of the strategy and planning. So, Ashley.
Sure. I'm Ashley Pearl. I'm the Community Resiliency Manager. I only spend 50% of my time on housing, but it feels like a lot more than that. So strategy and planning is anything that we're trying to do or trying to assess. So a number of, there's 2 projects on my list right now where with potential partners with the U.S. Forest Service. So the Elgibel property and then the S-Curves property. I also maintain partnerships with CDOT and Habitat and other folks in the Valley, always looking for opportunities for the county to partner to either conserve existing housing, convert free market, or to build new. And then I spend a large portion of my time, or at least I did this year, helping launch the West Mountain Regional Housing Coalition, so the new nonprofit. Now that they have a staff member, I'm hopeful my time will be less there, but it was really essential that Pickens County was able to give my time so they could kind of get off the ground. And we were able to dedicate our roadmap funding towards getting that off the ground too. So I know you heard from April and the West Mountain Regional Housing Coalition 2 weeks ago, and I don't know if we celebrated enough at that moment, but I do think Picken County had a big role in getting that off the ground. So I think it's something to be noted. And then when we look at 2024, some continued money for partnerships and planning. Our membership here, Francie, that was your question. Our $20,000 is our membership to the West Mountain Regional Housing Coalition. We did put money in for 2024 if the board wants to pursue any sort of ballot initiative around housing. This would only be to assess the ballot initiative feasibility. So running polling questions and then kind of thinking about what the ballot language would be. Obviously, we don't. Staff in the county would not be pushing for any sort of ballot initiative. That would fall to the board, the public. But this would get us up to that point. That's a placeholder, and we can make that decision later as we kind of see what shakes out and where we're going to go this year. And then the last piece of that is the ARPA revenue. There's a lot of numbers up there. I hope Connie did the math, or I know Connie did the math. But the last one is the ARPA revenue so that we can pursue those housing programs that we talked about 2 weeks ago. I think that's
with
everything.
the coalition.
Some of them are with the coalition, and some of them are with either Recovery Resources or West Mountain Regional Health Alliance. So I put 5 different options in front of the board. I'm remembering now, you weren't there, Francie. So as I'm looking at you, I'm remembering that. I presented 5 options. So we had, when we received our ARPA money originally, the board said they wanted to spend 50% on childcare and 50% on housing. So we've reached our 50% mark for childcare. So you all asked me to bring back what we could do in housing with that money. So I brought back 5 options. They total $2.5 million. You only have $1.3 million ARPA remaining. And it was really just a touch point to say, is the board interested in these sorts of opportunities? And if so, we'll go and build them out further. The board said they liked all 5 opportunities, so staff is starting to build them out further and kind of assess feasibility. As they become either feasible or not feasible, we'll bring them forward to you one by one, and then you'll have the choice to move forward with funding it with ARPA or not. As a reminder,
I remember reading about it. What is LACTF?
The Local and Tribal Consistency Fund, and that's like ARPA but way less regulated. So we can use it we've used it on things that don't qualify for ARPA but are in the same vein. So that's where we pulled our $500,000 contribution to response out of.
Okay.
And then should I talk about the rental program, or you want to?
Sure.
Okay. One thing that we forgot to put on the slide is a $90,000 placeholder for a rental assistance program for Picken County employees, so employees of our organization. This is at the request of the board. A while back, you all had said, wow, we have the deed restriction program and we have a down payment assistance program, so we're really helping employees with purchasing homes. What are we doing to help our employees rent homes? So we ran some quick math and we put in a placeholder. That would be $90,000. The thought there is kind of like a first and last assistance, but we haven't built it out much further than just putting a placeholder in there because obviously we need to have the conversation with the board moving forward. But that is also in this housing strategy and planning budget. I think that's everything up there.
Where is it?
We forgot to put it on the slide.
Okay.
So when you look at the budget for
just to see
you're
if we would notice.
You passed the test.
Actually, that one was my fault because Ashley put it in the slide and I took it out because I thought it wasn't in the budget, and then I found it, and so that was was all my fault.
You don't want to know how the sausage is made.
It's getting worse by the minute here.
There's a lot of problems to solve, it seems. So.
Oh, the housing area has been complicated.
You think?
But that's kind of a good thing, because if the board stayed solely within the parameters of the housing impact fee, it would be nice and simple. It would be one place, one fund, and one type of usage.
Yeah.
But the board has a lot of different initiatives and a lot of different areas that you're exploring. And so that's why you see all of these different layers, because we're trying to use different funding, the ARPA funding and the LATCF and all of these others as resources to be able to advance the goal, the priorities and the goals of the board.
I mean, I think of it the way like our strategic plan gets broken up in the budget, right? There's sort of different areas and we attach different money to those different areas.
So within this housing and strategy budget, the personnel line item, the housing rental assistance program is actually within the personnel line because it's an employee benefit.
Oh, really?
So that's why it falls under the personnel category, and
I
that's
see.
what had me confused initially. Ashley mentioned some of the different studies or professional services on the slide before. And then down at the last line item here, you see housing programs and contributions, 2.55 million. And this is where those other initiatives that Ashley brought to the board just a week or two ago come into play. That part of this, about half of it, can be funded through the grants, through ARPA. The other half would come out of the board's allocation for housing. So hopefully that makes a little more sense now, seeing the part of it that's within the general fund.
Yep.
Questions? Okay, that's it for housing, unless the board has other questions or direction.
I don't have other questions.
Okay, we've touched on a number of different areas today with law enforcement, human services, public health, and hopefully have really touched on all of these different success factors in the livable and supportive community section of our strategic plan. So we will be back before the board next week looking at natural and built environment. We'll have the first part of that budget presentation with the whole infrastructure group. And so we look forward to meeting with the board at that time.
Thank you, Connie.
Thank you.
Thanks, guys.
Thank you.
Thank you.
Cara, I haven't seen you in a
Thank
long
you.
time. You're a stranger these days.
Just you wait.
Okay.
Five minutes ahead, fancy.
How about that?
Oh, we have a break scheduled.
Yeah, but we just took one.
Yeah.
That's the way I feel. How about you?
That's fine.
Your next thing is Matthew with APSHA, and he's not here quite yet,
Yeah.
but I can ring him and see.
Well, we can do future agendas or open discussion on that.
Yeah, let's just do future agendas, John, while we're waiting for Matthew.
So have a few things for you. We'll start with some of the easy stuff. CCI Winter Conference registration has started. We get early bird rates through Friday, October 20th. And so if you could let Lainey know if you plan to attend.
When is it?
The dates are November 27th through 29th. Be in Jefferson County again. They've moved away from the Elegante in Colorado Springs. Amazing.
Are you going, Kelly?
I don't think I can go this year.
Okay.
I think the Elegante was demolished.
Well, that would be appropriate and and a good reason not to go there.
Are you going, Steve?
Well, I haven't totally figured it out yet. I was tentatively planning on it, but I need to double check the calendar very carefully.
Okay. Well, let's stay in touch about that.
Okay.
When's early bird over?
October 20th.
Oh.
It's coming up really quick here at the end of the week, yeah.
It does look like we have a work session scheduled for that Tuesday, the 28th.
We always have a conflict with CCI and budget, it seems like. So what we've done in the past is either the commissioner or commissioners at CCI have joined online or caught up. And I usually join online. I'm over there.
Okay.
P&Z is also planning a site visit before the presentation on the Redstone Castle. If you're interested, they're going to be touring both the interior and exterior. I know typically the board sometimes likes to do these site visits. We thought we might do them both at the same time.
I've never been there.
If possible. It is impressive. Right now, we need to probably put a few dates out there. We're looking at potentially October 30th, 31st, or November 2nd, possibly November 6th. But if you if you want to go and you have any of those dates are better or worse for you, if you could let Charlotte know.
Okay.
Tell me again the dates, October 30th, 31st, or November 6th?
2nd and 6th. Sorry. Too many S's in there.
Let's see. Well, I can probably figure it out right now.
And this is for the amendment to their master plan?
Correct.
Or the
When is that coming
second or
before us?
sixth.
It looks like, well, it's going to Planning Commission on December 5th.
Any of those dates work for me.
And Francie, it sounds like you'd be interested in going.
Definitely. I've never been to the castle. Crazy
Okay.
it sounds.
Do we want to tag on Doorway Way?
Good.
While we're over
Yeah, we could.
That would be, yeah. Okay.
But not, yeah. So the 30th is a Monday. Those are usually pretty good.
That's fine, yeah, that's fine for me generally. The middle of the day is sort of better. Just 'cause I have to shuffle.
And which date? I'm sorry, Kelly.
Any of those days.
Oh, any of those days.
31st is
maybe
Halloween.
not the
Don't you-
second, 'cause
Don't
we
you have
have
to
a
do
QQ.
kids on Halloween?
Yeah, but in the evening. I mean, if. you
The
know,
second doesn't work for you?
It doesn't, no.
Okay.
But the other dates do. I just would
So
request some of that middle of the, you know.
Okay.
It's hard for me to get places at 9 in the morning sometimes.
especially in Redstone.
Yeah. It's not impossible, but.
Well, let's plan a lunch at the inn on that day. We're
Yeah,
gonna do both.
that sounds great.
Okay, and last thing,
And then, I don't know if you
oh.
heard our sidebar, we thought we could do Doorway Way.
Yep, I got it. Yep.
Steve, we're thinking about doing a site visit to Doré Way to go over the stuff that Rye was talking about. And I think you're pretty familiar with it, but I've never walked the whole road. How do you feel about that?
I would love to see the road again. I've been to Bill Doré's house before, and I've been to the Emmerich's house down there, but it's been, a few years since I've been to either one of those. So I would love to do a site visit and go down the whole road, really.
And what about the castle visit?
Well, I'll have to check those dates. I'm not sure, which ones of those would work.
Kelly and I are
seen
thinking
the
we
castle.
combine.
I mean, I'm very familiar. I've been in the castle a half dozen times over the years, and I wouldn't necessarily need to see the inside of it.
Okay, well, look at those
But
dates for,
If the date worked out, I would go on a site visit if the date works out fine.
well, look at those dates that John just said, because Kelly and I are hoping to combine the site visit to Doré Way and the castle, but the Doré Way also involves OST, so it's gonna get complicated with people, so just look at those dates
Okay.
and see what happens with them.
Last thing, our future agendas are really, really packed, and I think we have some big conversations that we'd still like to be able to have before the end of the year. And so wanted to propose, if the board's open to it, to maybe using some of our off Wednesdays to do a little bit of the mini retreat format. Some topics we need to be able to bring back. One would be a more extended exec on the airport FBO kind of negotiations and analysis of business analysis of potentially doing that, running the FBO ourselves versus what some of the proposals are, as well as the negotiations. We also need some time to probably, more so than will be allowed, I think, during our budget presentations, to talk a little bit about our mill levy questions. So, for example, we've got, y'all are going to have to set mill levies for open space and ambulance, as well as, doing the property tax. And also in this budget, in the 5-year plan and beyond that, relies on revenues for public safety projects and such. And we'd just like to spend more time than we'll probably have during the budget process for that. And then we also want to be able to sit down and talk a little bit about future of kind of workforce and how we're scheduling time, kind of following up on some of the conversations that were started in last year's retreat around analysis of 4-day work weeks and those sorts of things, so we can have a conversation about
our workforce.
what we've learned and where we're headed. And then, of course, we'd love to get some more time on housing too. So it'd be a series of maybe mini retreat type of formats, using those. I would suggest the off Wednesdays.
Well,
maybe there's a better
November
day.
1st, 15th,
don't
and
have that
December
many.
6th, it looks like. Honestly, for me, I would rather have like 3 hours in the morning and 3 hours in the afternoon in one day, rather than coming up
Multiple
two
times.
different days. I mean, I could see doing that twice,
Okay.
but to come every time for half a day is not as good for me, just for me.
Mhm.
Do you feel that way, Steve? You're the other one with the commute.
I guess I'd rather come in earlier on a day and, do one trip or a longer meeting.
Okay.
Personally.
Well, if the board is open to it, why don't we look at schedules? I need to coordinate with the attorney's office and staff, and we'll propose putting some longer days if you're open to that, and try knocking out a couple topics at a time.
Maybe
Can
throw a
you
lunch in the
also
middle.
Keep in mind APSHA's board schedule.
Yep.
Because they're on alternate Wednesdays.
Oh, they're on
And then
alternate
we run into
Wednesdays.
issues when we change our schedule for the holidays.
Okay.
So just something to
And they start at 4 now instead of 5, or instead of 4:30.
Okay. And we
Um,
could also look at Thursdays or such if that's better.
And throw a lunch into the middle of the day
Mm-hmm.
would be really nice.
Yeah. Okay.
Okay, that sounds good
That's
to
all
me.
I have for future agendas.
Okay, I don't have anything. Do you, Kelly? Anything from you, Steve, on future agendas?
No, but I just figured out that the 2 dates for the Redstone that work for me would be October 31st or November 2nd. The
So
other choices
That
don't
means
work.
October 31st, because Kelly can't do.
Yeah, I have QQ. They've asked me to chair
Oh,
it,
the
and
6th.
I don't want to. But I haven't said no yet.
And if we leave, no, that's a different day.
Okay.
Halloween, that's weird. October 31st that's a regular meeting day.
But it's the fifth
Fifth Tuesday.
It's a fifth
Oh,
week.
okay, thank you. Okay, it looks like October 31st, unless Patty and Greg want to get involved and they have other needs. I can't remember when Greg comes back. Does anybody else remember? 10 days, I think. Okay, I think we're ready for Matthew then. Okay, we're gonna have an ABCHA budget presentation by Matthew.
John, do you want me to pull up the slides from last time, or what do you want to? I just asked that actually, and she said no, but do you want me to? Otherwise, here I am again.
I actually would just for the public, yeah.
Okay.
Hi, Mate.
Okay.
Give me a sec, let me pull up the slides from last time.
What does all county Halloween mean on October 31st?
Everybody in the county has to participate.
Everybody has to wear a costume.
Yes.
Oh, yeah. It's a potluck.
We're doing a potluck.
We're gonna miss it.
And the
I bet it'll
kids
be
usually come around trick-or-treating.
Oh.
And if we're all in Redstone, is that gonna be weird? They don't really care if we're here or not, right?
Well, we care.
The
if they're
kids don't
here.
care.
Kids don't care.
No, they care if they're getting candy.
Yeah.
I put it tentatively on my schedule on October 31st since, but the last time I did that, it stayed on there and I almost went to basalt.
Pull up the slides and the agenda, there's a link to get into Zoom from there.
Is it the same as last time?
It's the same every Tuesday and the same every Wednesday, so as long as you were here on the Tuesday.
Yeah, I'm not sure of it. We'll see.
I'm not gonna be at ABCHA tomorrow, because I'll be at CAST.
Yeah, that's fine. I'm gonna do it by Zoom, but have you looked at the regulation changes at all? I
No.
haven't read them yet.
No, but I will tonight. I don't have anything to
Just
do.
shoot me any notes if you
What?
have. Shoot me any notes.
Okay.
if you have any.
Yeah, what's the passcode?
618
Do you think that the ABCHA board needs to meet twice a month?
618
080.
080.
I mean, the way it turns out is it's like 4 months out of the year, we only meet once a month.
Yeah, that's
4 or
true.
5 months, you know.
In the summer, yeah.
And like October, November,
Christmas.
December, I think we only have
Yeah.
one a month.
Okay.
Prompt you to rejoin.
Yeah, let me just pull up the.
Let's mute your speaker.
Oh, yeah. Is that on? Okay. Yeah, just find out. Yeah, sorry, I just need to find it. Sorry. No, I'm just trying to find it, sorry. I had them all teed up last time, but sorry. Unless you have it. What I said last time, sorry. I'll get there, apologies.
Let's see, I probably do.
It's so
Was it
weird
the
not having that
third?
clock up there. I keep looking up there.
And then oh, you're already logged in.
Yeah,
You
I'm
can
logged in
just-
for that,
okay. And
yeah.
are you upgraded to a presenter?
Yeah.
Okay.
I just need to find those slides.
Send them to me.
I didn't, who did I send them to?
Liz had them.
What was that, the 10th?
Liz
Yeah.
waiting for you.
I sent them to myself, but no, I can't find them. I didn't send them to you, okay.
I don't think I have your slides.
Are you still in New Mexico, Steve?
Yeah, that's the, I keep finding the memo.
Steve, are you still in New Mexico?
Yeah, just got here to Albuquerque today.
You're going to be down there for a while?
Well, till next Sunday, I'll start heading back north.
Wow.
Okay, I'll just share that.
We did the hot springs tour on the way down. We stayed at Hooper Springs in Hooper in the San Luis Valley one night, and then we went to the Ojo Caliente last night.
Oh, you did?
So we've been in hot springs for about 10 hours of the trip.
Wow. And then when you come back from this, are you going to be gone again this fall?
And then share your screen.
I don't, no plans for,
Till we pass the budget?
And then shrink this.
yeah.
This thing.
Okay,
Maybe shrink it more if you can. It's like, oh no, you're good.
that's good. Okay, how do I make, I'll make this bigger. There we go. Okay, sorry.
All right.
Uh,
Well, now you're right on time.
I did pull up one other data point. We're having weird weird printer issues at Apsha, and we were getting in a big fight with Xerox, who locked us out of the system, but we fixed it now. So I couldn't even print things. It was,
Oh, gosh.
and they wouldn't accept our credit card. And Cindy was getting very mad at them, which was a little funny, but ultimately aggravating. Okay, so last year we asked for 59740, and the projection was for 2024, the projection was 747,900. So if you look at the request here, it's a little more, but that includes the supplemental. So I think we're very, very much on track with last year's projection for 2024. It's within a couple $100. So there shouldn't be any surprises there. And to remind everybody, the supplemental is for one full-time employee who will be I've billed it as community engagement, but that'll be a specialization on reaching out to HOAs, and that's reaching back to our goals about housing sustainability, looking at the current stock, partnering with our HOA partners, and making sure they have the tools they need. So to be looking at a lot of the best practices for HOAs, and also managing and analyzing the data we get from the HOA Capital Reserve RFP, which we put out now. So we're going to have somebody come out next year and actually do a capital reserve analysis on as many HOAs as who want to participate with, and we can pay for that with APSHA funds. That's not a separate city or county thing, but that'll give us a good idea of the situation with our partner HOAs. And it's a reminder, depending how you count it, we have anywhere between 60 and 80 HOAs. So I say because how you count it, because a lot of those are individual single-family homes, so they don't have common elements. So we don't really count them. We love them dearly, but they're not who we're looking at.
Yeah.
So the budget request is very much in line with the projection from last year with the supplemental request for this one full-time new FTE.
But it's more than last year.
Matthew, could you forward the slide to the expenditures? You're on revenues on the screen.
Yeah, that'll take that'll take give me a minute. I'm going to stop sharing because I know I shared this with you last time. Now,
So where
now
did
I can't find
where
it.
did this 450,000 show up in housing? Do you remember?
In Jody's budget, like operations, general fund operations.
Okay, thank you. Nice.
Sorry, I'll find the revenue side. Okay. I found it. Okay. And there's the structure, and here's the revenues, which is what you were looking for. Let me make that a bit bigger. There we go. So there's the subsidy from the city and the county, and then we have. Let me make rid of this. And then we get separate management facilities fees, including reimbursement for some of our maintenance staff from the city. So then that's also on the tax credit properties, so that's Truscott 2 and Truscott 1. And then the expenses are here. Move that down a bit. And again, I wanted to highlight the sorry, I'm just going to go back.
Why are housing sales under expenditures?
Because that is the, I think that is the money we have to make sales ourselves. So we keep that, $500,000 or so in there every year. That's under capital 53200, and that it gives us the ability to buy when they come up on the courthouse steps. For example, we bought 2 properties.
Oh, that's right. Yep,
We
okay.
bought the 2 properties at Woody Creek, and we'll sell them back hopefully
Right.
next year. Or it might be actually the year after once
remember
we
you saying
develop them,
that
right?
last time. Yeah,
And
thank
that gives us just, we don't have to come to you guys every time that there's an issue. And then again, I've got the slide on the supplemental, which is, part of our long-term effort to look at the sustainability of housing stock. And also, I think it's going to be very useful to actually have a better idea of what the HOAs need from us.
Yeah.
Yeah,
for
so
sure.
it's not just us telling them things, how to do their jobs. It's us learning how we can be better partners to HOAs.
Does the APSHA budget presentation match the city's format for
Yeah.
their budget presentations? Okay.
It is. I changed the headers, but it's the same.
Yeah. I just wondered.
And that's but that's just a part-time. The HOA coordinator person is, I thought you said a month or 2 months, right? And then this person is full-time.
Right, this is a full-time job to develop contacts with the HOA, And then we've got the RFP, which is open now, to get, a private company out here to do the capital reserve studies for the HOAs to actually see what the situation is.
Yeah, okay.
Great.
Any questions from you, Steve?
Nope, I'm good. I understood everything in the presentation Matthew did before. I think it's good, you're getting better control of what's out there and what, working with the HOAs, I think is terrific instead of just always telling them what they need to be doing, but this is a good way to approach it, and hopefully we'll get a handle, get control of the capital reserve issue on properties.
Great, thank you. That's the intention, and really develop a partnership with them. I think a lot of them, there's different levels of where they are in the process, when we want to get everybody up to a good level and give them the tools they need.
Yeah, this has been needed for a while.
Right.
It's great.
Matthew, what is the 5-year budget
Want me to go back to that?
projection increases?
On expenses, there we go. Let me get this.
Or how about, yeah.
Let me get this down for you. No, that's not what you want. Are you asking to see what the county's
Yeah.
projected? Yeah, there we go.
Yeah, what should the 20% increase in 3 years, what are we projecting that for?
So next year, the projection is 911, 987, and then in 2027, it does go over.
Is there special projects that includes, or is that?
That's just the general subsidy based on, the current operating expenses. So it's
Is that, will that cover anything additional, or is that just?
That's the basic. So like I did today, if there was something extra, a new position or a special project, I would come back to you and ask for it.
Okay.
Like we did for the essential repairs pilot program. We came back to you and we had a discussion. So that is just the normal day-to-day running costs projection.
Okay. There's nothing related to the home truck or any of the
No, not
fees
at this
around
point.
that? Okay.
But I didn't get into home track last year, but we are very aware that it's clunky for the user. We had some leftover money last year, which we were dedicating to improving the user experience. We had a contract signed. We were doing work with a vendor, and that work was not going well. And I made the decision to pull the plug rather than carry on in this uncomfortable relationship, which we didn't think was working. So we are looking at a long-term program for what to do with home track, but it's not easy.
Okay, thank you.
Great. Anything else?
Thank you.
Great.
I
Thanks,
think it's
guys.
all good. Thanks for coming back.
I love it. Anything to get me out of the office.
Yeah, I mean, I'll just say I continue to push APSHA to figure out like a full staffing plan. I continue to think APSHA is not fully staffed for everything it's responsible for. So I'll just throw that out there again.
Thanks, Kelly. Thanks for the support. We really appreciate it.
Yeah.
Okay. We're going to have Charlotte introduce Mache.
Excuse me.
And Francie, thanks for that pronunciation, because I was completely lost.
Well, that's half the fun. I use my middle name when I want to order food or get equipment.
I never have tried the second name.
Oh, it's so much easier. I don't tell you. It's too easy.
What is it?
It's Alexander. So Maciej Alexander Morotek. So.
Morotek. So you say the M. Okay.
Yep, it's Polish, so it's a little bit more fun.
Okay. Well, Mache has applied for the Healthy Rivers and Streams vacancy left vacant by Chuck Ogilvy's resignation. And Wendy, you appointed Wendy, reappointed her.
Charlotte, would you mind speaking up just a little bit?
Yeah.
It's not into that,
Okay.
just in the room.
So you all reappointed Wendy, so we just have the one vacancy on the Healthy Rivers and Streams Board, so I will let
In-
you all
In
ask
District 5,
questions.
right? It has
That's
to be from
correct.
District 5, right?
Correct.
And that's where I'm at.
That's where you're at. That's where we're both at.
Yep.
Well, I'm delighted that you applied, Mache. We've talked together quite a bit about Picken County, and this is a great way for you to be involved.
Yeah, I'm excited. It's a little interesting. It's a little bit of a learning curve, but
Uh-huh.
that's kind of half the fun. I've kind of been behind the scenes on a couple of the little other river situations like Yule Creek and
Yeah.
maybe or maybe not the airport photos of Marble's situation. But no, it'd be nice to get more out in front of the situation and assist in the future planning processes.
So for those of you who don't know, Mache did some photography of Yule Creek after the mine had diverted the creek without any permits or anything. And your work was really instrumental in waking people up and getting them aware of what's going on up there.
And it was also my brother as well. My brother actually filmed the pre-footage of it. He actually would come and steal my motorcycle and go play. And he was lucky enough to get the footage of right when they started doing it. And then I got the post footage. So it was a little bit of a wake-up call.
Yeah, yeah. So you're already a little bit involved in streams.
I am. It's not my main business, but it's definitely been my side hustle for a little while of just, I grew up in Redstone from the age of 3 to the age of, how old was I? I think I moved when I was 8 to Marble for a year. So I had a pretty good background in that area. And my sister, who passed away in Redstone, was very involved in a lot of things, dance and the Missouri Heights fire and a lot of fundraising operations. So I grew up kind of in the middle of that. And then we moved away for a little while just to warm up, and then I decided to move back because I had great memories. And so now I'm building a house in Redstone, which is, even more fun.
Pretty near the river, right?
It is. We're actually above, so on the railroad tracks, like right by Faloha Meadows, we're on the upper side. So a little bit better view, not quite next to the river. You don't have to worry about little kids walking into the meat grinder quite as much.
Yeah, really.
Actually, what was fun for my birthday in August, we actually just walked straight on to, took small boats late season and dropped in right on the OST property and went all the way through the Narrows and got to actually see that. And I've never seen, you never see from meat grinder down to Penny, and it was gorgeous. It's just something you just never see.
So you put in right below meat grinder?
Yeah, we're on the OST property, right at the bridge there. And then it was really shallow, and I had little tiny boats. And we paddled all the way down, went through Narrows, which was more just like plop, and then same thing there, like from the Narrows down to the Avalanche, take in, put out was just scenery that you just don't get to see. I do Avalanche down, I probably did it 20 times this year with the high water. But you don't get to see the other parts, which is just a nice benefit.
Well, does anybody else have questions for Mache?
Yeah, are there some particular projects that you're aware of or that you
not right now. I haven't really seen too much. I know there's a lot of, I'm more focused, my knowledge is more focused on the Crystal than the rest of the valley. There's a lot more than just the one river. My background is mostly Crystal, so I'm very interested to see the other projects on the other rivers. But I'm not really obsessed with any of them in particular right now. I would like to see some way to figure out Coal Basin, keep it from flushing out so hard every time it rains. But I think that's been a project that's been going on or desire for years. And they've tried restoration and such, but I'm not actually particular on any particular projects right now.
Heather said yesterday that it used to run black when it rained.
I remember as a kid, because I grew up in Redstone, I remember it was like it would rain and you'd literally see like that nice little water line. It still happens to this day, which is just, mostly it's just the sediment flushing out, because I know that was an issue with OST, was talking about Penny Hot Springs and how the erosion of the bank. And I'm like, well, if you're worried about erosion, that's like, maybe 5, 10, 20 gallons of erosion. With Coal Creek, it dumps 2 dump truck loads every time it rains. So it's, but I have no idea how you'd solve that. So I'd be curious to see something like that.
Yeah, great. I love that.
How about you, Steve?
Yeah, I'm curious about your position on, well, I know you've been active on the Crystal River Caucus Board for several years. What's your position on the wild and scenic designation for the upper reaches of the Crystal?
I would love to see that happen. I think it's a pretty aggressive, not aggressive. It's an uphill battle, being that marble is some of the marble has different politics to it. I think it would have been really awesome to have it when the Waltons decided to adjust the river, not just the banks. We would have actually had some teeth, because downriver, like, I saw it cloudy for days. I'm like, what is going on? And eventually we found it, and I took some photos of it and such. And had we had that status, the EPA would have actually had some teeth to bite, instead of, without it was just Gunnison County giving them a red tag and some, little tiny slap on the wrist. Same thing with Yule Creek. Had it been established, it would have been a very severe restrictions, or at least some enforcement. So I'd love to see that happen. I was on a bigger part of it, but I just started getting a little crazy with the house and trying to manage 2 kids, a wife, a house, and a business, easy stuff. So I kind of stepped back and let Bill kind of take over that position for the time being. But yeah, I'd love to see it happen. I definitely, it looks like a little bit longer of a not a fight, but a motivation versus it's not just a quick and clean. I'd love to see it happen though, so.
Okay.
Please come
And
on
how are
Thursday.
you for getting to meetings, either in person or virtually?
I work for myself, so it's not an issue. I have on my property I'm building right now, living on site, per a bunch of codes, which is so much fun. I can tell you each one of those. But I have Starlink, so it's not an issue as that. And then I usually drive in person to meetings. I prefer face-to-face over Zoom, but Zoom is quite beneficial when the storms outside are just not allowing travel and such. And during COVID, of course.
So your house is below where the typical mud flows come down in a big rainstorm, is that correct?
So my I've got a funny thing. So my house it's between the North Bridge and Flaha Meadows, kind of almost dead center. And there is a 9-foot drainage right outside of basically my deck will go up to it. But when the big mud flow happened, it actually happened farther where the drainage is. And so it's just a little tiny bit of my property got the mud, but it actually went all the way down from there all the way to the water when that big flush happened. So I'm very lucky. I have a massive amount of like the house above me built a big bank up, and then I have 2 lines of safety prior to my house. So it definitely was quite incredible to see that mud flow happen, but it didn't actually affect my place. It did. I have 3 ways out of my house as an emergency. I have the main bridge at the North Bridge of Redstone. OST has a bridge below me in case of emergency, and then my neighbors all the way out has a bridge, which for some reason the map likes to send everyone through the other way and go through this huge drainage every time without fail. But that was actually completely blown out. You couldn't, and I think OST came and fixed it. So we are fortunate that I think I'm in a pretty good spot. There's definitely no avalanche. It would have to have a pretty historic event, because we have a 9-foot drainage for it to actually affect my property more than a small amount.
So. Yeah. So it sounds like you have a good feel for hydrology and flood type events and whatnot.
Well,
so,
I have a background.
You have some board experience too, so that's good. That's what we.
Yeah. Well, I
good
learned
combination
fast.
for a board.
I learned fast because I joke now that I'm getting tired of learning, because I've been learning for the last 5 years pretty hardcore. But no, I'm excited to learn more. I mean, I love the river. Actually, I just got off the Desolation Gray.
Oh, you did?
On Friday, which was actually, I think you requested. I'm like, I can't, I'm going to be on the river. So we went, I have a 2.5-year-old and a 5.5-year-old. And then my wife came, and then we took another family with another 7-year-old, just a one person. We did so 6 of us did 86 miles, which was delightful
86.
until the wind we had one windy evening, and the camps were full, and we had to push through like 1 foot waves. It was
Upstream wind, of course.
Oh man, it was good. It was
What was the water running at?
like 2,500.
Oh,
so it was a little low. It took a little longer to get anywhere. The water was just cold enough that you could get in it, but it wasn't swimmable. My 2.5-year-old we took a paddleboard through some soft water, some little bit of a riffle, and all the kids wanted to go. So I was in the middle of a big paddleboard. My 2.5-year-old's in the front, and my 5.5-year-old's in front of me, and that 7-year-old kid was behind me. And my 2.5-year-old loves it until he gets wet. I'm like, you can get wet, so hold on. He gets wet and just loses it. Just had a frustration time.
I can imagine.
And I'm like, we're going through more. You got to hold on. He grips back on. He's like, and just, he hasn't quite got his full speech in. So it was a lot of like whatever 2.5-year-old screaming, cursing is. But he was happy afterwards. So it was a good time.
Well, I'm delighted that you applied, Mache. I know you've wanted to be involved. And my son Rio was interested in applying, but when he heard you were applying, he said, okay, let him do it.
Well, yeah. Well, we both applied for the BOCC, and I was like,
know.
I'm too busy. You got it.
So now it's flipped.
Yeah, for now. We'll see.
Oh, it's great.
So, awesome.
I loved having somebody young involved and somebody who
I
lives
used to
it.
feel young. Now I'm feeling like I'm not as young anymore. I used to think of myself being so young. I'm like, wait, no, actually I'm not
Pretty
as...
damn young.
Yeah.
Yeah, I would just say this board has a hard time meeting quorum, so they it would be great if you could be more consistently there than some of the other folks have been able to be.
I do my best. I mean, of course, there are times that you know how it is. But with Zoom, it makes it a lot easier if you're not able to run around. Being that I work for myself, it's a lot more convenient because I just came off a job. I'm like, as long as I don't yell at myself too much, I'm usually in good shape.
Yeah, good.
So.
Great.
Do you have any questions for us?
Not really. I did some reading on it, and I'm sure there's a lot of information I'll learn on if you appoint me. But other than that, I feel pretty confident.
And Lisa and Lisa can answer tons of questions too, and you know them, so.
Yeah.
Okay, great.
Awesome.
I think that's all we need.
We'll come back for a decision when we have a full board, or?
I think so.
I think Greg is back next week. I'm not sure.
I'd like to give the other board members an opportunity to watch the video and weigh in, which is what they usually do.
Perfect.
So.
Awesome.
Thank you, Charlotte. Thanks,
Thank you.
Mache.
Nice seeing you too.
See you soon.
Take care.
Cheers. Thanks for coming out. And yes, please come next Thursday to the community summit for the wild and scenic
Yes.
process.
Sounds good.
That's at the high school, right?
Yeah.
Yep. Awesome. Take care.
Say hi to Stacy.
I will.
Okay, now we have something with Liz.
Yeah, I wonder if we want to hit open discussion, because I think we had our auditors joining also.
Okay. Alrighty, I'm happy to go into open discussion. I have one item. What does everybody else have?
I don't have any for you, because we had a short time frame scheduled.
Liz has raised her hand.
Oh, Liz is here, okay.
She's here.
Okay.
Recovering from surgery.
Oh, she's at home, okay.
If you'll promote her, and then we'll, but maybe we can finish open discussion, and then we'll go to the.
Okay, mine is the letter from Clint and Kate Coert, whose house burned and his parents died. I think it was his parents. And they wrote and asked if there's some way that we can help them. They're trying to rebuild. And I thought that possibly one way of helping them would be to waive their fees. I don't know if we ever do that.
So we have not had that practice in the past, but we also haven't had a request of this nature.
Mm-hmm.
And so it really is at the discretion of the board. What we have done in the past, for example, when nonprofits have asked for permit fees or such to be waived, is the boards actually are just appropriated them and paid for them, kind of taking money out of one pocket and put it in the other, just to ensure that the processes, if you start doing a lot of waivers, it can start to look like we're not collecting enough revenues and it can affect other fees. That's not a situation we're in right now with our building fees, but we've tried to keep that consistent. And so the board could choose to appropriate, the board could choose to waive in an exceptional circumstance, but we probably we don't have a mechanism within the code to do it, so we'd need an action of the board to do that.
Okay. Did you read that letter, Steve, from them? They live up near you, right?
Yeah, they live just over the ridge on Monastery Cutoff Road, which we can actually see the very end of Monastery Cutoff Road from our house, but we're on the other side. One question I had on it was about their insurance coverage from the fire. I thought that well, not knowing what their insurance was, but that it seemed like that would pay for the building fees to rebuild, but maybe they only get a lump sum. I wish we knew a little bit more of their, the financial situation there.
So how should we proceed on this, John? What do you think? Bring it.
Well, I guess maybe if the board could give some direction, whether you want us to find a way to, support the family, in some fashion as requested, we can come back with a solution on that.
Yeah. And I would like to try to help them out. The coroner's report today, that was the fire she was referring to, where she had to borrow the firefighters' boots to be going into the ashes of that house when it was still hot, where his parents died. So it's just a tragic situation for them, and they want to stay in our community. And if we could help them somehow, I would like to do that.
They have, the letter says they have submitted their projects and their permits to Pickens County, and they're in the queue. So do you want to pursue it, or?
Well, I feel like I need to think it through. It would be helpful to understand what the fee breakdown is.
It's a percentage.
I guess I'm wondering, because like they could potentially be a candidate for like the future TDR conversation related to square footage,
Yeah, once we get that.
I know. No, I know. I don't mean to like hold that off, but like perhaps there's a credit or something. I don't know. I'm trying to think sort of creatively about this in a way that's like equitable. I don't.
No, it's hard. It's hard to figure it out.
Yeah.
It's 60,000 in fees.
It's a percentage of construction costs.
Yeah.
Another possible way we could help if we could move them up in the queue to the front of the line and let them get started on their project. Do we want to buy a deed
restriction from
that?
That
could be very helpful too to them.
Like, are there other ways to?
We could suggest a deed restriction.
Think about what would be helpful, but would also, like, it's just hard because, I mean, I don't know them, which isn't, but there's a lot of people I don't know, that, like, I'd like to think about a way that if some other person came before us, we'd have a way to be thinking about.
I like that suggestion. How big is their property, Steve? I mean, do you now have any idea?
I don't recall. It seems like it was maybe 17 acres or something like that. The properties up there, they all have some acreage with them. They're varying amounts.
Is it in a subdivision surrounded by other houses?
Well, it is in the gate, not the gateway, the Shieldo or Shieldo Terraces. I'm not sure which
Oh, it's
of the
near
two
Shieldo.
subdivisions.
Mm-hmm.
Oh, that end.
Mm-hmm.
I see. Okay. Well, maybe we could bring it back to a work session when we have Patty and Greg. I know Greg is interested in helping them. So let's do that.
Well, we can look at what we can figure out. I know we don't have a process in place, in terms of the equity concerns or what have you. I think if something like a deed restriction would probably be a bigger contribution because you're buying out equity and such. And they may or may not be interested in that, but that may be an opportunity too. And they presumably would qualify to be, they're working and such.
Yeah,
So.
I think that's a great suggestion. Okay.
I'll think of other.
I don't have anything else, and Liz and everybody are here. Okay, so let's move on. All right, so our next item is an annual comprehensive financial report for the fiscal year ended December 31st, 2022. Hey there, Liz.
Hey, I'm sorry I cannot be there in person. I had knee surgery on Friday, so I am recovering from that at home.
Wow.
I have with me our auditors, and I believe in the room we have Julie Nelson and Ann Driggers, and I'm not sure who else is in there since I can't see the room. But we are all here to present the 2022 financial statements, and I'll let Paul do a little, because we have a short amount of time. I know we have to be fairly quick. So Paul, if you want to just give your little spiel, and then we'll answer any questions the board may have.
All right, guys. My name is Paul BOCC. I am a CPA over in Edwards, Colorado, and I'm with the firm McMahon & Associates. And I think we audit probably 15% of the counties in the state and all kinds of municipalities, pretty much all of CAST, Colorado Association of Ski Towns. And also is Yadira Miller, who is both a CPA and a certified fraud examiner. And she helped run the engagement and is here to back me up with any questions I can't answer. But I'm going to just share my screen and I'm going to just motor along because, as Liz said, time is limited. So let me make sure I got the right screen here. So this is, well, that's actually my kids. But
very cute.
Old picture of my kids. But this is, I just briefly want to walk you through kind of what we do when we do an audit. So this is actually your audit binder in our audit software. So we do planning. And the highlights of planning is, reading your minutes, understanding what actions you've taken, looking at other entities and seeing whether they fall under your financial reporting umbrella. And then probably the biggest part of that is going through and looking at internal controls. So we spend quite a bit of time looking at internal controls, trying to understand who does what. So these are kind of all your areas of internal control. We meet with landfill, we go through and basically ask them questions of how does money come in, how does money go out, and then we actually pull a transaction from landfill to make sure we understand or what they've told us is accurate. And we're just looking for improvements in internal control, which will come up in a little bit. Then there's some other areas of planning, but in the interest of brevity, I'll move on. Then the second part, all that kind of happens before year end. After year end, we do field work, another week of field work, and it's 4 CPAs, generally 4 or 5 for you guys. And we're verifying numbers. So this is your cash and investment section. Here's treasurer and pooled cash. Here's various investments, retirement fund. Each of these is a work paper. Here's where we sent confirmations out. Each of these is a work paper done by a person in our firm, and in this case, reviewed by me. But the goal with cash and investments is to make sure that if your financial statements say you have X dollars in the bank, it's in the bank, it's insured by FDIC insurance or another thing called Public Deposit Protection Act. It follows your investment policy. It's a reasonable, prudent investment for you to have. And that money in the bank is available for you to spend as you see fit. Same thing with receivables. Somebody owes the county money. We want to make sure we're billing them, we're collecting it timely. When a check comes in, it gets deposited timely and it's handled appropriately. And it's coded correctly. So if you're sending out a bill and somebody makes a payment, that gets applied to that bill. Same thing with with the airport and proprietary funds, we kind of do that in two separate areas. We go through your capital assets. We want to make sure any new assets are added to the insurance rolls, depreciated appropriately. We go through accounts payable. We want to make sure if you're making a payment, it's a reasonable, prudent payment for the taxpayer to undertake. It's budgeted for, it's paid timely. We're not paying interest, late fees, things like that. We go through all your payroll. We want to make sure if you're paying an employee, it's following your payroll personnel policies and that you reported to the IRS what you reported on your books. And that's kind of how we test payroll. Same thing with debts. We go through all your debt obligations. When debt is issued, there's a lot of things signed that the county promises to do, and we have to make sure we comply with that so that we can maintain our quality debt rating and we're following through on our promises. There's a new standard on leases. We kind of had to do a fair amount on leases this year, making sure that we've complied with certain standards to record leases as debt obligations. Basically, accounting standards don't differentiate between leases and bonded debt anymore. It's just a different financing mechanism, but it needs to be treated the same. We go through your equity. That's, making sure we started this year with where we ended last year. Do we have the correct table reserve? Do we have the correct reserves in each of the funds? If we had ballot questions requiring a reserve or a debt service reserve, we want to make sure we have those. We actually have to do some additional work for Colorado Department of Public Health and Environment on solid waste landfills. And then there's just things like various ballot questions you have had approved in the past, your home rule charter, are we complying with all those? Intergovernmental agreements, are we complying with those? Talk to your attorney, do we have any legal contingencies? We go through a lot of state statutes for counties, trying to make sure that we're complying with state statutes, and we want to keep, obviously, all the elected officials out of hot water, and to the extent that that's possible in any county. We go through all those Colorado statutes and make sure we complied with that. And then another big chunk is called the single audit, which is auditing all the federal grants. So it's kind of a significant process. You actually have 685 different work papers that were scanned in and included as part of this engagement. And the goal is to produce audited financial statements, which are in your packet. And they're, lengthy and kind of a long document. And that's because there's a lot of different uses for it. So it's going to go to the SEC, go to all your bondholders. It's going to go to rating agencies. It's going to go to insurance agencies. It's going to go to the federal government for getting grants. It's going to go to state government for landfill compliance, state grants, local highway finance. There's just a lot of different parties that use it. It's not necessarily just the BOCC or elected officials or even the electorate. But I'm really not going to go into a lot on the numbers. I am just going to mention that that your county does an additional level of reporting. You submit it to an organization called GFOA, and they review it, not necessarily for the financial results, but for the parts of the report, making sure it complies with GAAP and it's easy to read, and it kind of includes everything that it should. And you, in the past, have gotten that certificate of achievement and excellence in financial reporting. And I really think that is a nice feather in the cap of your finance team. The audit opinion covering this report is from us. So actually the report is from you guys. Liz does a lot of work on that. And our opinion says that to all these parties that use it, hey, the numbers are correct, and you can use it for the purposes that you need it. And you can see there's 685 work papers that kind of stand behind that to make sure those numbers are correct. And that's really the goal, is to make sure each organization can produce audited financial statements that are materially correct and parties can use. And I'm pleased to say Pitkin County has done that. I am going to jump to a letter though. Well, is any questions on either the process or I guess the financial results? But if not, I'm going to jump onto a letter with some recommendations because I think that's probably what the BOCC is most interested
I
in.
just have a quick question about how many man hours does this take or woman hours?
Oh, good question. I don't have that off the top of my head, but you know, counties are anywhere from 400 to 700, and I'm guessing you're at the closer end of those 700 hours.
Wow.
So, you know,
It's just their side of things. That doesn't include obviously all of our time on things as well.
yeah, which would
that's
be
right.
significantly more.
Yeah.
You know, there's, you know, hundreds of millions of dollars rolling through there, and it takes a lot to make sure the numbers are correct.
Yeah.
And you know, I mean, we take that obligation very seriously. I know, you know, it's a lot of kind of nerd work in the background, but it's important that Pickens County can produce accurate financial information. And I know your finance team takes that seriously, and we take our role in that process seriously about making sure that the numbers are correct when they go out. This is a letter from us as independent auditors to you as a governing board. And it has a couple of items some that we just have to communicate and some recommendations. So the first thing we have to just discuss is qualitative aspects of accounting policies, which means what new accounting standards were implemented and kind of what changed. As I mentioned, there was an accounting standard for leases. Basically, it takes leases and treats them as the same as a bank loan or geo bonds or anything like that. It's a lease is just another debt instrument that's handled appropriately, and it does that on both the leasee and the lessor side. So we've implemented that, and or Liz has implemented that, and we've checked all the numbers, and we're pleased to report that that's handled correctly. The second part of this is what's the biggest estimates. Sometimes you have some really hard to estimate items, a legal liability, maybe an environmental liability. You guys have pretty standard estimates. Are we going to collect all our receivables? Yes. Historically you have, and I anticipate you will going forward. What's the estimated life on capital assets? You use standard lives. I wouldn't change any of that. But you know, if things last longer than anticipated, then we'll extend the life on the assets. And what is it going to cost to close and monitor the landfill after closure? You get a study done by environmental engineers, and then we have to apply those numbers to dollars and submit that. Ultimately, that all gets submitted to Colorado Department of Public Health and Environment, just as kind of a compliance aspect. But those are updated every 5 years. Overall, no difficulties in countering performing the audit. It extended a little bit because of the next one of our recommendations. So I'll go into that. But overall, your team is great to work with. I'm comfortable calling up anyone on your team and saying, hey, you know, we need this, or we have an issue, and I know that they understand the importance of the audit, and they want the numbers correct the same as we do. So that's really where you want your clients to be. Corrected and uncorrected misstatements, that's kind of what journal entries did we have. We had, you know, I guess 4 different journal entries, but none of those were particularly concerning. Those are the type of items that we would normally have with almost any county audit. No disagreements with management. I think, you know, we try and discuss what's coming up during the year for the future year and kind of get everyone on the same page, and that kind of takes care of hopefully any potential disagreements. Your staff does sign what's called a management rep letter. That just means that they didn't lie, cheat, or steal is kind of what I refer to the letter as. And we have that in our records. Upcoming, there is another new standard that will have an impact on the county. Basically, if you have technology agreements, think Tyler agreements or any of your large technology subscriptions, we have to kind of handle that a certain way going forward. I don't know that it's going to have a huge impact on Pitkin County, but it does have an impact anywhere where you're spending a lot of time and money modifying stock or cloud technology or the Oracles of the world, PeopleSoft, things like that. But we'll go through that, and your team is aware of what needs to be done on that. So that's up and coming. We do have a recommendation. CPAs have 3 types of recommendations. We have what's called a material weakness, and that's when there's a problem that could cause a material adjustment to be made on the county's books. And this year, this is kind of an area that we really did have some concerns over. Basically, the bank recs, the checking account bank reconciliation was delayed. And we want to make sure that those are done timely. So the bank account that I'm talking about was the main checking account. There's a lot of transactions, a lot of dollars that roll through it. It's a really complex reconciliation. It doesn't necessarily have a lot of cash at the end of the year. It probably only had, $7-8 million in it, but every transaction, every payment is going through there. There's probably $20-30 million that can go through there on any month. I looked at December, I think there was $20 million coming in and going out. So it's not a small transaction. I know there was some employee turnover and different role changes that caused the reconciliations to fall behind, but it is critical that we maintain those on a timely basis. I know you were caught up through 2022. I'm not sure where you're at in 2023, but it just is an area that has too big a risk to make sure that we're not getting those done kind of right after month end. That's the biggest area of concern. I'd say, 90% of the audit's great. This is probably 5% or maybe 8% of the 10% that was not as great.
Paul, can I
and then
understand?
there are just
Sorry, what is the risk that you see? I mean, I could guess, but I'm not,
In the cash reconciliation?
Yeah.
transactions can roll through that aren't approved, that you wouldn't become aware of until the reconciliation is complete. So if there's a wire transfer or a false check or something else going out, it doesn't get caught timely, and that's really the concern. And also, if there's an error that flows through there and you need to do a journal entry to fix an expense or a deposit or a revenue, those don't get fixed in a timely manner when they fall behind.
And for us, I will just say that the errors is more likely to happen. We have other fraud protections on our bank account to prevent from unauthorized wires or checks that are being issued against our account fraudulently. So I will say that we do have protections from some of those other things, not justifying being behind on the cash reconciliation. It's something that we're putting a lot of manpower into getting caught up and doing on a timely basis moving forward. But just saying that we do have other protections on the account.
Yeah, and there was, through 2022, there was error corrections, but there wasn't any, fraudulent transactions. But it's a critical control. And with that said, software changes, personnel changes. It's not unusual to fall behind, but it's just something that you have to take seriously, get caught up. I think your finance team has, but whenever we see that, we're going to bring it to your attention.
Sounds good. Thank you.
There is some other comments in here, and these are more of the vanilla FYI, here are things just to be aware of. You've actually had this this comment in the past, and it really isn't significant to me. But you do have a 5-year maturity on your investment policy, and you have CMOs. For those of you that don't understand, CMO is a collateral mortgage obligation. Basically, they take individual mortgages and they bundle them up. And so even if you have a 30-year, this bundle or a tranche of 30-year mortgages, they would have a technical maturity longer than a average maturity. So, and that's because people sell their home, they refinance, all kinds of things happen in that tranche. So the maturities end up being quite a bit shorter, but it would be what I would call a technical violation of your investment policy. So you've had that's going to kind of continue until the average maturity drops below that 5 years. The second is just inventory. There was some segregation of duties there that I think could be improved. My understanding is that has already happened. It's really just making sure that no one person has the ability to modify the reconciliation and make purchases, and that's largely been done. Landfill had some deposit checks that there was kind of a lag in getting those deposited and getting them recorded. They ultimately were, and there was no issue with it, but we want to make sure that those dollars hit the bank as soon as possible. And we also did talk to your finance team about using the Munis AR module for landfill, which I think is a little better method of tracking than what they were doing, at least in our opinion. And my understanding is they're going to work with the landfill staff to make sure that that is rectified. There were some contracts out, and keep in mind, these are recommendations. When you audit a county, you're going to have recommendations. So don't take this as anything negative. It's par for the course with doing an audit. You should be concerned if you have an audit that doesn't have recommendations. There is some contracts with airport vendors that had expired, to Go Rentals and Aspen Transportation. I believe you guys are working on those. And the good news is you have this new OpenGov procurement software that's, I think, going to be able to track those renewals in a little better manner. ComDev, this was, you have a couple types of fees that are tracked on this Excel spreadsheet, and we just said, I agree that it doesn't make sense to modify Sage for those particular revenues, just because they're fairly complex, and you'd probably spend more on the software than you'd collect on the fee. But we just wanted to make sure, to whatever extent possible, we lock out the formulas in those Excel sheets, just to make sure that they don't inadvertently get changed. But that's always a challenge kind of with any ComDev department. So we trust Liz to take care of that, because she's kind of an Excel guru. And we have our own Excel gurus that look at that, but Liz is very knowledgeable in that. So leases, we did implement GASB 87. We just want to make sure moving forward, that's going to have an impact on the financial statements that's different than it has in the past. So we want to make sure there's a process by which everything goes to the county attorney and finance is included in that, because ultimately it can have kind of require an adjustment on the books. And our understanding is that is or has been implemented. So that is, I guess, all the news that's fit to print on the audit. Those are recommendations. I think, the main one that really we had concerns over was the timing of the cash recs. It's really critical to make sure those are updated timely. And as Liz mentioned, kind of once we sat down and went through our concerns over it, they jumped on it. I think spent probably quite a few man hours getting everything caught up. But going forward, we want to make sure there's a process where that's done monthly. So.
Well, thank you very much, Paul. Any questions?
Yeah, Liz, don't we approve this in a regular meeting?
Yes, I believe it's scheduled for the 27th. Is that what the next regular meeting is? The last one in October. I apologize. I don't have my calendar pulled up in front of me.
Okay, thank you.
Yeah, normally that's a motion to accept, just so, so you either accept it or I guess you don't. I've never had that experience of not accepting it, but but you never know, so.
Steve.
I'm curious about the check cashing procedure. Does someone actually have to take the checks to the bank and deposit them somewhere, or is there some way you can do it electronically from the office?
Most of our checks are done electronically, as you said. We have desktop scanners that the treasurer's office uses to scan those to the bank.
Okay, and then at the landfill, do they have that capability if they're, behind getting the checks deposited? They are not in town. Maybe they don't have the electronic capability from there and need to get them to your office. What's the procedure there?
Yeah, so that's a good question, Steve. We've always run into issues with their internet connection out there. Previously, for being able to do the remote deposits, I believe that has been resolved. So it is something that we could discuss with the treasurer's office. Again, we have to be very careful with who we give access to be able to do that as well. So we'll have to make sure we set up controls over that process if that is the direction we decide to go.
Okay, thanks.
Anything else? We are adjourned.
Francie.
Thank you, guys.
Oh,
yes,
sorry.
Liz, go ahead. Go ahead, Liz.
Okay, I'm so sorry.
Don't be sorry.
I didn't want you to.
Don't be sorry.
I just wanted to thank Paul and Yadira for all their time spent on our audit this year in particular. And then also Julie Nelson, who's our controller in the room there. She has spent a huge amount of time on this audit this year. So I wanted to thank her as well.
Me too. Thank you, guys.
All right. Thank you.
Thank you,
Now we're
everybody.
adjourned.